got other duties assigned. So, good morning, everyone, and welcome to our March 10th, 2025 Spokane County Board of Commissioners meeting 9 o'clock strategic planning meeting. Let the record reflect that we have 4 commissioners present. Commissioner Currens, Commissioner French, Commissioner Jordan, and myself. I'm not sure Commissioner Walters' status, so we will just go ahead and continue forward because we've got a pretty busy agenda this morning. So welcome everyone, and we're going to go ahead and get started with community services. So Justin, John, start.
Morning, commissioners.
Good morning.
Bringing the opioid dollar phase 2 priorities back for your review. The last update we gave you, we identified 2 phase projects, or what we're calling phase 2 for the next implementation of the opioid dollars. Part of that, board gave us direction to go ahead and explore the 2 that we proposed, and that's what we've done. And I wanted to just give a quick appreciation and thank you to the board for the contract you guys passed last week for STARS and partnership with Department of Commerce. It's amazing with that completion of that contract. Once they actually finalize the building, which I hear is going to take another 30 days or so for the closing on it, it will seal long-term support, not only for inpatient withdrawal management services, but also our project. So very much appreciate it. It's a next step forward in providing long-term support for our community and in recognition of the other facilities that have closed historically. So this investment is key, especially in light of some of the challenges the state's going through with future investments. So thank you so much for that. Update on then our phase 2. We wanted to give a quick one on where we're at with some of the original phase 1 conversations with our Crisis Relief and Sobering Center project and partnership with the city of Spokane Valley. We're still working, they are still working on the ILA. They continue to tell us that their plan is to give us majority of their opioid funds now and in the future. Their pot still is relatively small, even with the incoming settlements still to be projected. So once that's complete, they'll go before the board. We still hope by the end of March, early April. That still requires our legal team to review once we get it back from the city of Spokane Valley. But the last conversation we had, there wasn't additional terms in there, only that Spokane Valley continues to have access and the ability to receive services for their residents in Spokane Valley. So we'll be working with the sheriff as well on that once that's in place and CRSC is open, which I believe is currently scheduled for 2027 unless Senior Director Sparber can get that sped up. But otherwise, once that's in place, we should be able to allow for Spokane County residents. Next slide. So the 2 phase projects, phase 2 projects that we identified is really looking at how can we expand access for law enforcement as well as for community members when or in the instance of a overdose is occurring or it's individual has come into the ER and is experiencing that overdose or use or the potential for that misuse or overdose, getting them into a resource right away. And I know the CRSC facility, Crisis Relief and Sobering Center project, plans on having those walk-ins at 24-hour availability for referral and drop-off. But until that's in place, this is the stopgap. So one of the 2 areas identified, as we discussed last time, is MAT services and availability for walk-ins. I think you guys received an update from SRHD a couple months ago that indicated at any given time, due to the walk-in availability times, they may or may not be turning away up from 20 to 35 individuals monthly. We want to reduce that. And that's for the ones that they have said walked in voluntarily. There's plenty of other ones that have been deflected by law enforcement into the ER or other resources. We want to be able to provide expanded service on that. So in further conversation with SRHD, they are open to the possibility of partnership and funding, and they're also open to what that would look like to expand hours and staffing at the after a couple back and forth, especially with staffing and costs for insurance associated with recent increases. The current budget, they've got bumped back to about $800,000 annually to expand out services for more comprehensive walk-ins and for law enforcement drop-off. Now, we're still talking about if that would be a 24-hour. At this point, I don't believe we can make it a 24-hour, but really looking at those time periods by which individuals are more likely to be involved with law enforcement or in the community, usually the later hours of the evening or early morning when they're being discharged from the ER. So in those areas, those would be the focuses for walk-ins and treatment.
Quick
Yes.
question for you. On the anticipated 25 to 35 individuals per month, is that based upon the 16 bed or the 24 bed?
So this would be different from the staff expansion. That would just be those that are walking in for medication-assisted treatment and SRHD.
All right,
So
all
that's
right.
at the health.
Yeah,
Yeah.
okay. All right, thank you.
Yeah. Their current staffing does not allow for walk-ins, I think, past noon.
Okay,
And so we're looking at saying,
thanks for clarity.
the goal, the reason why that is a beneficial partnership, leveraging their existing contracts with Medicaid and state and commercial insurance. Once they're seen, then we transfer that care into their, under their insurance, and that isn't any long-term funding required on the county side. So really leveraging existing resources so we can better serve the community without any additional cost, other than what we've identified as an expanded service for staffing hours.
So,
Yeah.
so Justin, on that, you know, with 3 health board members sitting here. So what are they showing as what the additional costs are and how many additional people and what they think $800,000 seems like I don't know, like a lot to me for that when we have funds that are, you know, still available within the health district.
So this is based on an increase. Right now, it's estimated based on time frame. So more than a dozen new staff. So we're still roughly playing that out. The cost for those really are the medical professionals. Evaluation needs to occur by at minimum a nurse practitioner. They have to make sure the individual is clear. There's an assessment done for the health and well-being of the individual and determine other med involvement. Once that's complete, then a referral can be made for the psychiatrist to be able to review and make a recommendation. And then the med is dispensed by nurses. And then you've got techs. So really, because of the medication being so controlled and the necessity for them to have health and bioassessment, that's where most of the cost is, staffing associated with the higher level credentialed medical professionals. So for nurses, there's certain shifts, and then they're also saying they may require overtime for certain shifts if there is no coverage available by an individual. So for example, we increase hours, they have one nurse on shift, they call in sick, you need another nurse with overtime to cover it. So we increase, they had to identify overtime costs, administrative costs, process, also some additional costs for the building maintenance and for those specific areas. So we kind of estimated this. Now, what our experience has been, especially for the administrative costs, it's already built in. And so those are actually more reduced in the overall cost to say it's 15% across the board for administrative costs. Well, if you're leveraging that time for an available staff, you don't have to rehire. So really, it's about how much is that percentage. So I give you the worst case scenario based on if we would pay it all out on its own. I think the actuals will come in somewhere probably 20% lower than we're estimating. But again, we're doing this based on what we know at the time. That might change if the need for like a nurse comes up.
Thank you. And just for our legal counsel, there's only 3 board members here, so it's not a quorum. So we have this discussion.
Clarification. So the current walk-in hours are what?
From what we last talked about is 8 to noon, based on availability of staff. So that changes.
Pretty small.
Yes, if the staff are not available, so that actually can shrink. Again, that may have changed since we last spoke, but they did indicate right now based on limited and the total number of individuals they're actually seeing as part of the caseload, which is why it's reduced. They have scheduled appointments. The walk-ins allow for anyone who isn't already scheduled. They're looking at a week out in terms of getting appointments scheduled and getting people in on best case scenario. So walk-ins would reduce that time to get in, but it would still have to go in a queue for a scheduled appointments for ongoing follow-up care.
With follow-up. But this would essentially remove a barrier for those who are trying to get into have that medication as quick as possible.
Yes, for that immediate, gets them in, so they're not waiting 2 weeks. Yeah, that's a critical time when you're engaging, especially with law enforcement. They've got someone, they may have just used Narcan and they just got released from ER. They're now okay, but they're not, and then they get referred after 2 weeks. That's a sort of loss. We end up seeing them back on the street, and what are they gonna go to? Back to the now. So we want to prevent that. And then having the expansion of STARS also allows a unique partnership. When hours are not available, they can be referred over to STARS, and then they can receive treatment there and then referred back to SRHD. There's a place to go, so they're not lost, and there's transportation back and forth between the facilities. So these are really, these two phase 2 project expansions really look at leveraging the two resources, but ensuring there's connectivity between the two. And we're getting better bang for our buck in terms of the utilization of both spaces, especially with census.
Who does the transportation?
Right now, that would be STARS, and we still need to work with our law enforcement partners too. If they're dropping them off, the question is, can they call in advance so they're not wasting time sitting outside? Let's say they call SRHD and they say, no, we're gonna close, take them over to STARS first, then they can bring them over the next day, and then law enforcement doesn't have to bounce back and forth.
So what you were saying is if someone's needs to use maybe one of the sobering beds, is that what you're saying at STARS first? Then they can go be assessed like the next day.
Or they could enter, if there is a walk-in over at SRHD, receive treatment and then be referred over. The goal there being, they may or may not be at the time assessed by SRHD ready for treatment. They may say you need to withdraw and then come over for another assessment.
Okay.
Then we've lost them. Putting over STARS, we have them 24 hours in there, they go back and then they come back for another 24 hours. And then we've got that individual off the street, out of the ER, and then the moment they're done at sobering, we can transfer them over to the SRC for inpatient treatment for more intensive level of care. And then really we're seeing people, based on this referral connection, off the street for up to 7 days. Minimum standard generally for a stabilization period. Which is why I'm also recommending an expansion of additional beds at STARS to allow for that. As I reported back the last time when we talked about STARS, we initially opened for 6 beds and then 6 triage chairs. That was immediately filled without even having to open it up to the public. We hope to open it up to a greater extent to the entire county. But once we do that, we don't want people sitting outside waiting for that availability. So part of the recommendation is to expand out up to ebb and flow, 12 beds and then 12 chairs. So 24 overall slots. That could be scaled up based on need, meaning we could have 12 and 12, plus the utilization of additional individuals if they're currently sitting over at another facility waiting for in, and they're just kind of swapping them out. So really it's a greater expansion of bed than we've used to understanding, right? When a person's in a bed, they're there for 24 hours and that's full. They can't leave, they're not. We can only consider that bed to be off limits. With this kind of work between 3 different partners and the use of STARS' withdrawal management beds, it's an ebb and flow based on where the need exists, and they can move them much more easily. And that allows also for the partnership with the ER that STARS used to have to transition those individuals that are sitting in the ER into a sobering bed, so they're not taking up space there as well.
Can you remind me, last time you briefed, I think you had some kind of stat on what of those who go into these sobering beds, how many had gone on to kind of the appropriate next step for their treatment?
Yes,
Yeah.
Ashley has those
Those numbers,
current numbers.
yes,
Yep.
absolutely. So with STAT, 221 individuals have been served through sobering and triage services since December 9th. 26 just this month alone, as I checked this morning. And about 80% of those individuals are being transitioned to withdrawal management services at STARS or other facilities within the community. 62 individuals have been referred to medication assisted treatment, MAT treatment. And then other various referrals are occurring as well, such as referring individuals to the Spokane Regional Stabilization Center, other sober living, outpatient treatment services.
And the important thing about the withdrawal management, the average length of stay there is 7 to 10 days. So then that means once they're referred up, it's not just 24 hours, it's over a week out of what they may have been experiencing in the community and no longer involved with the potentiality of risk with previous behavior.
So the average stay is 7 days, is that what you said?
It's average for with the withdrawal management, yeah.
With the expanded walk-in and drop-off services with SRHD, with the methadone clinic there, the last 2 months, we actually received presentations at the health board that have focused on how there is a large number of individuals that try to utilize the walk-in services and are turned away because the staff are busy with existing patients that had appointments.
Yeah.
If you discussed that this would expand staff, so they would be able to handle the walk-ins. Is the concept that those staff would be dedicated to walk-in? Or, I mean, I worry, we help increase the staff, they schedule more appointments, and then the walk-ins are gonna be faced with the same problem that the staff are just working with somebody who already scheduled an appointment and they have to turn the walk-ins away. So, I mean, it's,
Yes.
and
that's something we are working with them on because you're right. We increase it by caseload, just a singular individual by 20 new people a month. At that point, if it is, it's overwhelmed their capacity to be able to do services. So part of this is also expanding the mental health treatment providers and the substance use providers to allow for them to take on additional caseloads. What they're telling us is it's about timing. So if they get a person in walk-in, they immediately receive treatment where they don't need to go then utilize substances like weed. That gives them scheduled out another week. And so then that gives them time, which they would have normally already had scheduled to get them into services ongoing. So that additional staff that we've hired that can do both, right? The walk-ins during the scheduled hours and then the additional caseload, we are hoping that would cover that. I don't believe after a year, we're really looking at 35 new people that aren't in services. We're hoping to keep them in services so they're not coming back as a walk-in. So that's our hope. We will continue to evaluate because you're right. At a certain point, it may hit a saturation that does put us back in the same situation. That's where we're also talking with SRHD to look at long-term strategic planning with their own funds. Is this a possibility that if we get more into treatment, they get more money from their insurances, they can also increase staffing to reflect the need, right? That's our hope. But it's not always a one-to-one when you talk about it that way. So the first part will be to ramp up, see what the numbers are, and then evaluate, and then really talk about what are the next steps if this is sustainable.
thank you.
I'm gonna just double check it. So on the numbers again, you said
Yes,
them fairly
sorry.
fast, but actually, it's all okay.
So 221 individuals since December 9th have utilized sobering and triage services. And of that, 26 just this month alone. 62 individuals have been,
A couple of weeks.
yeah, exactly.
Not even.
And of the individuals that we're seeing less repeat utilization by the same individuals, which is indicative of individuals continuing treatment and not needing to come back for the sobering portion, which is what we want to see. 62 individuals have been referred to medication assisted treatment services, with the majority of individuals, around 80%, being referred to continued withdrawal management services.
And the withdrawal management services, which SRSC does as well, is 3.7 level of care that provides an intensive medical component as well. That is where the average length of stay is anywhere from 7 to 10 days. Again, it's all different based on what insurance and utilization management, but that's an average. So those are big numbers. 1.2 additionally annually, as well as 800,000 annually. So how do we plan on doing this? Well, we are looking at a comprehensive approach from the region. A lot of individuals are from the Spokane area or the Spokane city proper. And so we're looking at how can we best partner with from a regional approach to address that need, while also recognizing that the need across the county exists. So next slide. Part of this discussion, based on the last update that I provided as well, is that we're also looking at saying, can we work with our partners who are also receiving opioid dollars to serve these individuals as well as their individuals in a more comprehensive approach? So we are recommending that we look at a joint partnership with the city to look at how we can share costs associated with the individuals and also collaborate as the two largest recipients of the opioid settlement funds in Spokane County. That not only recognizes that a lot of individuals, again, come down to the downtown corridor for services and for congregation, and then also that law enforcement in this area tends to experience, as well as fire, a greater instance of those involvement as well as with the ER. So there's a lot of different reasons why this works. Again, collaborative process and shared costs also reduces our costs associated with the project. We are already surveying individuals, Spokane County residents, but also Spokane City specific individuals. So it's just reflective of what already is occurring in the community. And then I think it does demonstrate, and I think this is what you guys hear me talk about all the time, that collaboration is key to ensuring that we address an epidemic that does impact all of us in the community. And recognizing that the city has expressed interest, and it is always great as partners to be able to reach across and say, how can we partner together? So next slide. If we did this, we're recommending a 50-50 split of these costs, which would reduce our overall annual allocation of the opioid dollars to $400,000 and up to $600,000 respectively, based on the two projects. Again, these are estimates. We are hoping with the STARS, we had estimated 1.2, but that would actually be reduced to a greater extent based on the fact that we're building that out, and the facility cost for rent will also be reduced because of the investment that we've made in the building. Again, the staffing for up to a certain amount remains the same. You need the same number of staff for a 24-hour period if you have 12 or 24. And so that's why kind of an all-inclusive cost for that. We also will be utilizing SCBG dollars to offset those costs. So actually for the Spokane County side, we should actually see a greater reduction. Again, dependent upon what the state's final budgets are. You know, they did take back the 10 million. And we also anticipate that the feds will also be reducing allocations in the near future for block grants. Now, we allocated the vast majority of that to this project. But again, I can't know until the end of the session here what the overall outlook would be. We've been assured that they won't cut all of it, but there will be something that has to give. The other thing is we're still waiting for feedback from the state on a proviso that we received for Eastern Region. This is acute care diversion funding, pays for almost all of the non-Medicaid services there at the SRSC, as well as the expanded services. Or did approve us to do expanded services up to a level with mental sales tax at SRSC. Really, the proviso takes the bulk of it. If we lose that 1.3 million annually for Eastern Washington, which King County wants, then that could change how we respond to those services at the SRSC. So we are strategizing on the impact there. Should have better numbers for you in the May period, but for now, we've been told green light. Don't expect any significant reductions at this point. So, do we have the money? Yes. In your handout, you should see a draft opioid tracker. It has a project numbers based on years, and in there is a cumulative. That cumulative amount, and working with Heather, takes into account the total amount of administrative costs estimated if it was removed. We're not using the full amount of the administrative cost, but we removed it just in case. So what would it look like in a worst case scenario if all funds were expended based on the project as well as administrative? Again, I say to Matt, not legal yet because we don't know the impact based on utilization. We have the funds to do this project at the full amount without the SABG added. It's leaving in, I believe, 2026, about 1 point something million, and then it increases further based on additional settlement dollars that we receive. So after about 3 or 4 more years, we're back up to about 5 million, I believe. So still bringing in some funds, but able to maintain existing costs into the future without taking away the ability for the board to still invest dollars as we begin to evaluate new needs in the future.
Can you speak to any conversations in terms of planning that you've been having with law enforcement, just about their piece of this and the coordination there?
Yes, so we've been working very closely with Sheriff's Department and talking with them about what that would look like to ensure that there are individuals coming in receiving services from the outlying areas in Spokane County. One of the biggest concerns by all of municipalities outside of the Spokane corridor is they want to be able to have access to the same level of care, even though their numbers may be less compared to the city, still have walk-in availability. In working with the Sheriff's Department, we had asked if you are involved with them in the community, is there a possibility for you to be able to drop off like you used to do with the Spokane County Detox Center? And working with STARS, we do have a plan to meet with the Sheriff's Department there for them to tour, talk with the patrol and see if that's a possibility. I think the biggest concern is really, do they have the time and staff availability when they're driving in to take a sheriff offline just to be able to transport in? And is there a better way we can meet them at a certain area and have them transported by maybe car 50? Working on that with the city and with STARS. Currently, the city fire is contracted with car 50, which is the detox van to be able to transport. And they only do city limits of Spokane based on their existing contract. Our conversation with them to say, hey, can we partner together? And so the sheriff's on board with meeting to looking at it, very supportive of the idea of utilizing STARS going into the future, especially as a deflection from jail. However, we still need to meet with them to discuss how that would look for their team.
I mean, I think these are things we have to be doing. I mean, it's ways of keeping people out of our jail system, so, I mean, that's what I see is it's diverting from the hospitals, but it's also diverting from our jail. And giving these people a chance to detox holistically versus in the jail is not always the best place for someone to detox. Like it's barbarous, as we know. So if we can get them to a better place, then I think we're gonna have better outcomes. Because it doesn't matter, a felony is gonna, in better jail. I don't know, it just. I think this is the one step that we can do right now to try to curb what we're seeing on the streets, as we saw with the medical examiner, our deaths are not going down, the rest of the nation are going down. We're not here. So we've got to figure out how to do that. And so this is means of helping to do that. And if we can have other people participate and help pay for it, with dollars that we have that are allocated specifically for this, because those dollars can't go to other, I mean, they can go to other things, but if they can go help with this, I mean, I see that as a good thing. I ran into Sean Cross from Maddie's Place as I was headed to DC last week. He was just nothing but complimentary on how Spokane County was really leading and stepping up and really helping to support these, babies and families to get them the help they need. So I see this as, a great way that Spokane County, again, and your team are leading the way for our community to make it better, safer, and help people get back into productive place in society.
So what happens when the city says it doesn't really collaborate? All the 100% of the cost is on us. How much of this can we afford on our own?
That's a great question.
Thank you.
I've evaluated this because this is always the risk associated with what does it look like when partners have other priorities. So we'll be meeting with legal, if the board approves to move forward with exploring this, to talk about, we want the money to be transferred to us. The city will be giving it to the county. We're looking at that being in an ILA, so we can guarantee that they are locked in a partnership there, but also that they front those dollars, recognizing our projects will go forward as we stipulated. There'll be a fronting of the dollars. So there's a little bit more buy-in on the front end. That would be my recommendation. The second aspect is scalability. Because we already have contracts with these providers, the goal is to say, once those are locked in, SRHD can move forward. we have to have confirmation the city's on board and we have the dollars. With STARS, we already have that in place. That's the cool thing about the investment we already have. So we'll just scale back down to our existing contract, the 12 and 12. I mean, the 6 and 6 with 12 overall does not mean we'll get the benefit of having additional beds, but it doesn't mean we lose the service. If anything, Spokane County will continue to truck forward and provide that level of care. There is availability then at that point to pivot, and the board can say, we still want to invest in these projects, add additional beds, but it won't be up to the 24. We'll add a couple more, and we still get the benefit, but not at the same level we could have when we partnered. So that's all built into this partnership, as well as working with Matt and his team to ensure that language is clear, definitive, and legally binding in terms of ensuring that you're joining us for the long haul. Marriage, if you will, where we.
Oh, wait a minute. Now we're finished.
Healthy marriage.
Yes.
I'm not gonna comment on that piece, but I think we should move forward. I think it's a great concept. I appreciate your team's leadership and vision. I like the law enforcement coordination piece of it. I think that's really important. And just gives them, another place to take people other than the current options that they have, depending on the circumstances and what's the most appropriate. When I went and did a ride along with BR or the BHU, that was the number one thing the officer said is, where do we take people? Where do we take people? And so this is an answer to that. And then I just applaud as well the conversations you've been having with the city. I think I agree. If we can get other folks to help chip in here and grow in the same direction, that's good for all the citizens. So I expect that will be a successful partnership.
And update to long-term planning with funding. We are working still on House Bill 1813, which will designate or carve out certain crisis services within our region, which will include 23-hour crisis relief and sobering services. If that's the case, then our region will have a little bit more control over how those dollars are allocated from the insurance companies. So instead of saying to, like, Pioneer runs SRSC, we'll pay this amount, then you have to negotiate the rest. All of that money will be given to us, and we can negotiate all the costs associated with all Medicaid and then the portion of non-Medicaid. It just passed the House, and we do expect it to go to the Senate. If that's the case, again, the board here will have a greater control over flow of dollars for residents within the region, which again, better for regional response, but also gives a little bit more a surety that if we join a project, we have a bench to work from with the available funds. Now, again, I say that with a recognition of where we're at economically. But utilizing our existing contracts means we can avoid having to do an RFP. We can just expand our existing services. So that cuts down on administrative costs for us. We can also leverage their existing contracts. Again, reduces the overall cost expectation on us because we'll just transition them into another service. And as Ashley pointed out, we're getting them into other services immediately within the 24-hour period. They're not sitting there and we're continuing to expend funds on that. They're going and utilizing their insurance in other ways. We're already demonstrating the effectiveness of utilizing the system more effectively and efficiently. So I think that would be my answer. And then I'll tell you in May if that's correct.
Yeah.
So I say this.
That was an important one. Because I think, again, sometimes as we know on the west side, they don't always think about Spokane County and where we're at on the east side. And so I think, having the medical examiners give the numbers before I testified was really helpful and huge in that. So I think that's going to be a good thing, because otherwise they like to keep the money over on the west side.
Yes.
So
Having spoken representative was excellent. Thank you so
So
much.
that was, so I think we're gonna see, from that bill and then from future ones, that Spokane's then a player in this whole system that it hasn't been as much in the past. So
Yes.
thank
we're
you for all
trying.
your work afterwards. Because you got tagged after to go over to meetings with the governor's office.
Yes. Having your face on the screen testifying is so much more fun. So you had the hard work there.
So I think at least we're showing in the crisis system that we, Justin's team really is on the forefront.
I just wanted to say, I think we're moving in the right direction and like investing in the facilities we already have. Like, we already have the opioid treatment program, the health district, we already have, STARS is already, like now, hopefully owning the building and growing the beds that they already have. I mean, it makes sense to build upon what we already have in the community rather than trying to start up something. We know we want to expand, stabilization center, but that's gonna take several years. So this is stuff we can do now to see people faster and get them off the street. So I think we're moving in the right direction. And if there's stuff we can do at the health district to work on, the sustainability of this, just let us know from the board member perspective.
Definitely. Yeah, that will be forthcoming. If I've got all 5 head nods to move forward and at least have conversations with them, present back to the board.
Being all 5.
Excellent. See,
There you go.
that's great. Thank you all so much. And just as a side, we did do a review of opiate dollar use across the state of Washington. That's something I would try to look at, see if someone's doing it better, because I think we are, and I don't want to make sure that we're staying ahead of that pack, and we are. In fact, we are the most innovative in terms of providing rapid response services as well as getting community feedback. So we continue to lead that, which is a sense of pride for Spokane County across the state. But there are, as we've indicated, we still need to rapidly provide those additional beds to prevent what we've seen in our community to be an increase in deaths that's not nationally reflective. So a lot more work to do, and we'll get on that. Thank you. Have a wonderful morning.
Thank you. Okay, sorry, everyone, we're behind schedule a little bit, but I think that's a great conversation to have, so. We will go ahead and,
Morning, Commissioners.
say who's on here.
We have got a few guests with us here today to talk about the Spokane Regional Continuum of Care, the 5-year plan to reduce and end homelessness. Before we get started, I want to let you all know that we'll be coming to you in a few weeks with a draft interlocal agreement between the city of Spokane, Spokane County, and the city of Spokane Valley. And that interlocal agreement is really in response to some of the regional homeless collaborative, making sure that the jurisdictions are working together to reduce and end homelessness, align where appropriate. But that document is really centered on this 5-year plan to reduce and end homelessness. So we want to make sure that the continuum of care was here in advance of discussing the interlocal agreement so that you all could get some perspective of what's in this plan. So with that, I'll let Shannon and Matt go ahead and speak on behalf of the continuum of care.
Good morning. I'm Shannon Boniface. I am the vice chair of the COC board, and this is Matt Anderson. He is the newly appointed co-chair. And we're here today to share with you a bit about the 5-year plan. We are close to finalizing this. It's been, close to a year's worth of work. So anyway, I think one of the things I want to point out is that I think we talk in our community about a lot of different plans in regards to homelessness and homeless service provision and affordable housing. And I think sometimes it gets a little confusing, like what plan are we talking about? Why are there so many different plans? And I think that I would just say that the 5-year plan to end homelessness is driven by HUD. And it's really the plan that really directs the homeless service provision in our community. So we've often talked about how we could kind of consolidate or eliminate the need for so many different plans. One of the things that we've talked about, and I think it's one of the things we will continue to talk about over the course of the next 5 years, is perhaps this being like more a piece of the consolidated plan instead of, so that you could almost have it be a pull out of the homeless service provision. That it feels a little more incorporated than having so many different plans. And I think we do align our objectives to what Commerce has been working on in terms of the statewide plan. So we're trying to have some alignment. We're trying to make sure that a lot of these things have some similarities, some alignment, so that doesn't feel in our community like we're having, you know, several distinct plans. Feels like it flows a little bit better. I think that George put a slide in that had the objectives. I don't know if we could put that up there as we talk about.
So we need one or two more. One.
There you go. Okay, so objective 1 is promote an equitable, accountable, and transparent homeless crisis response system. So some of the ways, the strategies that we're looking to meet this objective, really is going into what are the different service provision in our community that really meets folks at that front end. So outreach, coordinated entry, community court, emergency services, prevention, diversion. Those are some of the highlighted areas in this objective. Another place that we really are looking about in terms of equity is by name lists. So by name lists are utilized, we utilize the HMIS system, Homeless Management Information System, to pull out who are the folks that are currently identified as homeless in our community, whether they've come into contact with outreach, whatever the method by which they were represented in this pool of individuals. And then through that, we create a list and really look at like case conferencing, look at different methodology to address each of those individuals and what their specialized needs are. So that's one area that we're diving more into. I think another area is really some of this prevention work. I think we're looking at how typically in systems, and we address these in other objectives, but typically systems are prioritizing those who are most vulnerable. But we know in our community that like there are folks at all different levels who need some sort of intervention or have some sort of need. And if we're only addressing the needs of those who are most acute, most vulnerable in the system, then we have folks who, like on a prevention end, maybe they're just behind on their rent, that we can prevent them from entering that homeless response system at all. And so really we want to look at what exists in our community and what strategies we're putting forward to meet all of those different levels of need, not just our most acute individuals and families. So some of the action steps related to this are developing and maintaining the by name lists, looking at equity and disparity across the system. So using our HMIS system and other tools that Commerce has to really identify how are folks experiencing all levels of the system, and are they moving through that system in an equitable manner? And then this is also where we look at, in terms of accountability, our quarterly reporting and our system performance measures. So all of the services, all of the intervention types that are funded by the COC will be assigned system performance measures and be measured on those. Those will be reported to the COC quarterly, and then we'll make ongoing funding decisions based on that performance and the needs of the individuals in our community. So that really kind of encompasses objective 1. Objective 2 is about prioritization. So prioritize those with the greatest barriers to housing stability and the greatest risk of harm. So our coordinated entry system is utilized to prioritize individuals and families in our system. You may have heard the term SPDAT. We historically used the SPDAT, which is a tool, an assessment tool in our community for a number of years to determine folks' level of acuity and prioritize them in the system. This year, we were able to create a new tool. As a community, we came together, looked at what other communities were doing, and created our own tool to get away from the use of the SPDAT. So we will, in the course of the next 5 years, be assessing how that's doing for us and making any adjustments accordingly. Again, talking about case conferencing here. And then this objective just really heavily leans on the coordinated entry system and the quality of the coordinated entry system and how it's getting individuals and families connected to those housing interventions. One of the things that we look at is what's called dynamic prioritization. So we change prioritization strategies based on those who are presenting in the system and their individualized needs, and then what's available to us in the community. So for example, if we're seeing lots of people who need that like prevention end, then obviously we want to make an investment more in that area. If we see a heavy need for permanent supportive housing, then our investment in those strategies needs to increase. So making decisions about our funding and our prioritization based on what we're seeing and who's presenting in the system, and being dynamic in our response versus just creating one level of prioritization and always addressing things in that sort of manner.
But I just, thank you, Madam Chair, to follow up on that. So how often will you then be able to pull data and make those adjustments? You know, looking at HMIS, oh, we need to, and how nimble can you be if you've already like allocated most of your funds? You know, or I guess I'm trying to understand that.
I think
I know the
it's,
city's been trying to make like multi-year investments, right?
Sure.
In
sure.
projects.
So the CSD, one of the things we've been doing most recently is we've created a reallocation policy, which we hadn't previously had. And so really trying to create some of the framework around being able to do that in a more nimble way. I think historically, we've only really ever looked at how folks really have been doing when we're doing those renewals annually, but we're really creating methods in which we can address it on a more quick basis. I also think in response to that as well, I think that it's only been the last, I don't know, cycle, I would say, that there has been more accountability around those quarterly performance reports. So in the past, they weren't, you know, our collaborative applicant, which is the city, wasn't necessarily processing that data and communicating with us in a manner that was allowed for us to respond in a quick way.
But I think that's really important because when I was down in Houston visiting there, they call it a navigation center, but it's for people who have already been assessed and they're awaiting their housing assignment. And, you know, some of the folks who are involved in managing the Houston system, you know, through the Coalition for the Homeless, they were noticing, for instance, this one service provider wasn't like spending down their dollars. And so they then did some, you know, they met with them, did some counseling to help them actually spend the money. It's not like a judgment, oh, you're not doing what you're supposed to be doing, but there were some barriers and they helped them work through what those barriers were so that it could actually house some folks faster. So I mean, that's the benefit of quarterly updates. You can see, well, maybe there's a provider that's not spending their money down, they're having some sort of barrier.
Right.
And then like working through that so that we can get those dollars spent, because sometimes you have to spend them within a certain amount of time and then.
I think, you know,
Maybe these were ARPA dollars in this case, but anyway.
yeah, but I mean, I think that's true of regardless of the funding source, right? The sooner you know that a service provider is struggling, then, you know, the quicker you can address that. And, you know, I think that one of the challenges we've seen over the last several years is that, you know, we do want to bring on new service providers. Perhaps they come in with a different perspective. Maybe they're serving very specific, you know, they might be more culturally relevant services. There might be things where we want to encourage new service providers to come into the fold, but maybe they haven't historically provided housing services, right? So, you know, there's ways in which you can assess that, partner, provide support, those sorts of things that are important for building our larger continuum of services. So objective 3 is prevent episodes of homelessness whenever possible. Like identified, we're doing a lot of work around eviction prevention. I think that I think one of the things that we're looking at is historically, particularly when we had a lot of COVID funding in our community, a lot of like eviction prevention or rental assistance was kind of one time, we'll pay what you're in arrears. And I think that what we're seeing is that folks need case management paired with that. They need some support over a period of time to restabilize. And that one-time assistance is really causing people to like come back into the system versus really stabilize and maintain. So taking some look at that, we are looking at a move on strategy. So a move on strategy is taking folks who are in permanent supportive housing and really assessing their level of stabilization and do they need that continued level of support after they've been in that place for a while. And some of those folks don't need that level of support anymore, and we can move them on maybe in a different voucher or a different sort of housing support situation so that we can free up some of that permanent supportive housing for folks who are more acute and are needing that level of care. So that's another thing that we're working on. Matt's gonna look at objective 4 and 5.
Yeah, good morning, everyone. I think we're on the wrong slide. It's the state's plans, objectives. As far as I think it's the next slide or two over, you'll see they're tightly linked. They're almost the same. The 4 is seek to house everyone in a stable setting that meets their needs. These objectives are also very interrelated. Making it clear. So one of the things that's highlighted here is being able to better predict future rates of homelessness, the number of unhoused individuals and households moving forward. And then if we know that, then we can assess current, housing inventory and if it's sufficient enough to meet. Are we prepared for this with what we think is going to happen? The Department of Commerce has designed a modeling tool that can assist with predicting future point in time counts. And we want to also adopt system performance targets and hold service providers accountable to meet those targets, using data as much as possible to inform funding allocation decisions. Annually updating the housing inventory and one of the things we're proposing is to expand the affordable housing inventory through partnerships with businesses, philanthropy, like. Might want to have anything.
No.
Objective 5, the workforce, strengthen the homeless provider workforce. So we want to maintain a strong, stable homeless service provider workforce, and the specific strategies that we've been discussing, gathering, analyzing data from service providers regarding their workforce, being able to identify, gaps, weaknesses, wherever they may be, and really dig deep into this, conduct roundtable discussions with service providers staff to really kind of get a handle on this. The Department of Labor has data, the Department of Commerce has studies that used to develop a plan to address specific kinds of needs to reduce trauma and increase retention. It's been a problem.
So we're in the stages of finalizing the 5-year plan. I think it was out for public comment at least 30 days. I think it was kind of ended up being a little bit longer, but anyway, so we've taken those, incorporated them, and the board will be voting at the March meeting to finalize.
When the priority number 2 or objective 2, the prioritize those with the greatest barriers.
Yeah.
Housing stability. So another way to put that, those would be the folks that would probably be the most difficult to get housed as well. So it's sort of the most resources, the most support, we'll have to go around those folks. It seems, the thing most folks use is the point in time count that, to find that number of, okay, how many folks are homeless in any individual community? If you're prioritizing the folks that are the hardest to house. As opposed to maybe those that have just recently become homelessness due to a job loss. They've recently become homeless due to maybe a fire. The unit they're living in burns down. If you're focusing on the harder ones, do we face a situation where we're not able to reduce the overall homeless population as much as maybe when you're prioritizing sort of those easy wins to get people quickly back into housing that have most recently to sort of show or kind of gain momentum, kind of gain that community support that, you know, a lot of work, a lot of successes are really happening. What was that considered at all? Was that measured sort
Well,
of?
so I think it's as folks who oversee COC funding, it's a challenge. We're always considering that. We're challenged with the fact that HUD requires us to prioritize the most vulnerable. So
So that's not a decision you were able to make.
correct.
Oh, okay.
So we do,
Okay.
we do talk about what other strategies we can employ, knowing that that's the case, right? So like thinking about more eviction prevention dollars and how do we do that? One of the things, one of the interventions in our community that's really effective and a lot of people want to take advantage of is the rapid rehousing program. But a lot of our rapid rehousing is funded by HUD. So we can't change that methodology for that particular program. However, how can we get county dollars? How can we access other funding sources to fund that particular program so that we might be able to come up with different prioritization strategies and still employ that service provision, but outside of HUD funding? So those are some of the things that we consider. I mean, knowing that we're responsible for these very specific HUD funds, but also that's just one piece of the puzzle of the larger homeless response system. And knowing that, you know, we have to employ these other funds and these other strategies so that we can be providing to the whole continuum of folks who are needing support. So yeah, I mean, we're assessing that and trying to like partner, you know, a lot of organizations will leverage their COC funding so that they can, you know, kind of provide additional service provision outside of their strict parameters. But we have to try to figure that out as a board because HUD is expecting us to look with that lens view.
Okay, so can I ask a follow-up? So of these objectives, which ones did you guys have latitude on to what to put on there? I mean, if the prioritizing the those with most barriers, I mean, you're required to have that. Which of these 5 are ones that were actually determined here locally then?
Well, so HUD doesn't say these are the objectives you must put.
Okay.
We know that HUD requires us to prioritize the most vulnerable.
Okay.
We aligned these with what the Department of Commerce made as their objectives for the statewide plan.
Yeah, there's as you mentioned, there are a lot of similarity. I mean, they're essentially the same, just in slightly different order.
Right.
But so none of these are necessarily unique to Spokane then.
Correct.
Okay.
Correct.
So just following up on that from Commissioner Kern, so what you're saying is what is unique is how you're gonna actualize some of these
Correct.
compared to other counties that may have different challenges.
Correct.
Okay. So I think the draft plan is in our packet. Do each of these then have specific actions underneath each of them? Okay, perfect. So we can read through those and see what, I mean, you described them briefly
Yes.
today.
Yeah,
but-
it gets
okay.
into a lot more.
So my quick question was just, I thought that most of the HUD money was not around. My understanding of a lot of the HUD dollars is there's not a lot for number 3, preventing episodes of homelessness.
That is correct.
But you're saying you're looking at this as a comprehensive plan. Even though HUD money, you might not be able to allocate,
Right.
you can allocate other dollars to that.
I mean, I think that, so HUD money goes to supporting our homeless management information system, our coordinated entry system. It pays for transitional housing, rapid rehousing. and permanent supportive housing. And then we also have, we received a YHTP Youth Homeless Demonstration Grant. And that will be rolled into our whole COC portfolio. And that was coordinated entry for youth. And then, host homes, which is a project to support unaccompanied minors. And then, some joint transitional rapid rehousing programs for youth and young adults. And so while those are not like specific, this is specific funding for outreach, say, or prevention or whatnot, right? That, you know, in the coordinated entry system, we can determine as a community how that operates. One of the things we've decided as a community is that we want to employ diversion strategies first before any other entering the formalized homeless system. So that's what we do in our community. When someone presents a coordinated entry, they have a diversion conversation. And if we find ways which we can divert them, that is done. So like while
I see what you're saying. So you're still using the HUD money for the coordinated entry and that initial assessment. And potentially if you can just help someone with rent for a few months, but you just can't use those HUD monies for that. But you can use it for this data and assessment piece. Okay.
Yeah.
All right.
So, I mean, it's, those are the ways where you take, you know, things that are much more restrictive and pair them maybe with other things that are less so, and then meet the needs of, you know.
So what fund or pocket of money is there available to repair the damage from folks that have rented that are part of the low-income housing program?
Well, Commerce has some assistance for that. And I know folks have tapped into some of that. I think, you know, some of that depends on each particular provider. So let's say I operate a project where we're getting folks housed and it doesn't have to be low income, could be just a market rate unit. We're working with the landlord agrees to take our client. I think to some degree, the service provider tries to, you know, utilize what they have at their individual resources to help secure that situation, to take care of the situation if there's damage, those sorts of things. Now, you know, I don't want to speak for every service provider because I don't, you know, manage that. But that's the continuum of care dollars do not fund things like that sort of mitigation. Now, Commerce has some money, like I said, that we can tap into. There are some Commerce related programs like the Consolidated Homeless Grant that does help to support some different, not necessarily, you know, I don't want to get into the specifics of that, but there are some dollars that help to support some of that remediation. That's not something that the HUD dollars support. And then individual service providers provide some level of support for that as well.
So I guess as we look through this is my second time I'm going through the 5-year plan. You know, we haven't, because we always say to try to end homelessness, but we've just seen it increase over the course of that time that I've been here. And then recently there was an article that came out on, you know, through groups that, I mean, other states are having reductions and yet we're not. Are you guys looking at that as to what other states are doing to get those reductions versus what we're doing? You know, because especially if we're following the state plan. I mean, I want to know locally kind of what we're trying to do differently, because I think the article I saw was like, I mean, it was like New York, Texas, and Florida, like we're at the same number as if you combine them, their point in time counts for states. Our state is the same as those three combined. So I guess I'm just trying to figure out what are we doing differently as we go forward that is going to try to help our situation. You know, like you just heard the presentation before, we're trying to do what we can on the substance use side to get help to people. So it's like, what what do you see the team of parents is looking at as to what's happening in other places? From our auditors, I'm all about best practices and bringing those back as to what we can do differently here, because it seems like, you have the mayor and the city council that are driving the dollars, and I'm not sure how much the COC is driving those dollars. And again, as we said, they're programmed out. I think 5 years ago, I'm sorry, I've got this whole list of things. 5 years ago, we talked about measurements and having those measurements, and we never saw any of those measurements come back to the county commissioners over the course of that time. So I guess as we look to approve this plan, we're trying hard to figure out what we can do to make a difference and a change. And I know you guys are too, but what have you looked at that we can look at this plan as being different than past 5-year plans?
Well, I think, we do have conversations about what we see and hear about what's going on in other states. I think some of the things though that I think would be most helpful is we're getting access to data in a way that we didn't 5 years ago. And I think looking at our own data in a different sort of way. So recently, the city had submitted to HUD and was provided to our board so that we could look at it. It's called the longitudinal system analysis, and really broke down the different interventions and returns and how many from each intervention are exiting to permanent housing, and really analyzing our investment in different projects. So for example, emergency shelter, like the exits to permanent housing from emergency shelter are dismal. I mean, that they really are. And so when we have other interventions like transitional housing and rapid rehousing, which have much, much higher access to permanent housing and much lower returns to homelessness, then I think that, again, speaking to what Commissioner Waldron was saying, our ability to go, well, we're investing this amount in this intervention that's having these outcomes. Perhaps that investment should change, and the investment should be in the programs that are having the more significant outcomes. I think there's a lot to be learned from our own data is what I'm saying. I think there's a lot that we can do and change and do differently in our own community. And I would confer to Matt because he does a lot of research on this.
Yeah, so I was just gonna say that, I'm a professor at Eastern Washington University, Urban and Regional Planning. And I had a student who just finished her master's thesis who examined this very question about, what are we doing collectively as a COC, a community, and to what extent is what we're doing matching best practices? So she compared kind of the framework here with a number of other cities around the country and even outside of the country as well. Houston, Colorado Springs, Boise, some of the cities that have positive reputations about this. And she found that, we're pretty, the response is pretty strong and consistent with a lot of what these other cities or these other communities are doing within, funding limitations, which are severe. And sort of what, when you look at sort of the patterns at, homelessness rates are kind of stabilized or even come down in some other cities, and it's spiked here recently. A lot of it has to do with housing prices and vacancy rate. Those two things pretty much determine this with striking precision across the country. Here, right, I think in 2016, the median home sales price was $172,000. In 2022, it I think topped out at like 440. So New York is much more expensive, but it hasn't increased by such a drastic. It's almost 3 times as high. And the vacancy rate in 2021 was like under 1%, which is nothing, right? So we can respond, even if we're doing everything we can and we're responding really well, which I think we have. I think we perform really well. You know, we can't move people into housing units that don't exist, and that's been the problem for a long time. Now, things have improved, vacancy rates about 4% now. And the median home sales prices come down, it's still like 400,000, give or take a few $1,000 for sale, so it's trending in the right direction. And last year's point in time count would suggest that maybe we're seeing it stabilize. So the total didn't increase. We'll see what happens this year.
Good to see you.
You too.
I just wanted to piggyback on what you were talking about prevention and then the housing everyone buckets kind of rings true based on some of the conversations we've been having here about how we use our limited resources. Maybe a bit more focused on those two areas of prevention and some of the housing options. I was just curious on number 4. What are some of the strategies that you guys are looking at? You mentioned partnerships with the private sector. Do you have anything else to kind of flesh out what that might look like in this plan?
So I think that also would lend itself to the idea of having enough inventory of different levels, you know, so permanent supportive housing. I've been working, you know, I had another career before this, but I've been working in the housing world for about 6 years now. And it's, you know, what I have seen based on some of the things that Matt is talking about is we don't have the amount, we don't have the inventory of permanent supportive housing to meet the needs of people, the amount of folks who need that level of intervention, right? So then what happens, especially when we're having to prioritize based on that acuity level, is that then our lower interventions get filled with really high acuity folks. So, and they're not necessarily in a position to maintain that, right? So like with rapid rehousing, we provide case management and supports, move-in costs, and then potential subsidy for up to 12 months. In that time, the idea is that you're going to stabilize and you're going to be able to increase your income so that when the subsidy decreases over that year to the point where you're paying completely for your rent by yourself, right? But if you're a person who is maybe highly disabled and all you can get is disability, you're not going to be able to take over that rent payment. So like one, I think is having enough inventory to meet the needs of those who present in the system. And then also ensuring, and I think this can go back to the accountability piece as well. I will say that I think the biggest game changer for folks who are experiencing homelessness and reach stability is that wraparound support. How much case management are they getting? How much wraparound support are they getting? So ensuring that service providers are being held accountable for the service provision that they're providing to each of these individuals so that they can stabilize, that they can learn to like seek out resources themselves in the community, that they know where to go when they face a crisis. And we're service rich with that in this community. People can go out and access those things. But if they don't get skill build, they don't find a mechanism for building their income, then you know, they can't maintain once the service provider backs away. So I think that's a big piece of stability is really understanding what those needs are and being able to come alongside and meet those needs in a way that makes sense for them.
I know we gotta wrap it up because a great conversation, but to follow up on Commissioner CUNY's point about, you know, how are we planning to improve and how can we do better?
Sure.
Is the by name list something that will help? That's new, right? That's a new approach.
It's worked really well for veterans is where it's been most established
Right.
in our community, and it's worked very well for veterans. I think the biggest thing about it is that when we sit and staff, you know, Mr. Smith, we have to be able to pair the housing and services with what his needs are. And so that means that those have to exist to do that. I think that's how you get success with that.
And I was just in Houston, I think, even though they're running out of housing options too, over the last 12 years, they're much more sophisticated about all these different types of housing, knowing where those are, even if they don't have a lot of availability today. They know when I was down there, like this person needs this particular type of housing with services. And we know where those are and we're gonna plug them in and then, well, because they've been running out, they have this navigation center where people are waiting to be plugged in to that correct type of housing. But it just takes a long time. I mean, they've been working on it for 15 years. So we're just trying to build that system and become more sophisticated in those ways. But their by name list is kind of what I think over time helped them become more successful, right? In keeping people housed, success rates.
Yeah, I'll just add about Houston too. Houston gets a lot of positive press, they have a good reputation and it's well deserved. They've done a really good job in this. The relationships they've cultivated with landlords. and the like.
Right.
But I'll just add the caveat here that I think that the median home sales price is around 300,000. So it's significantly lower than has been. Housing's been cheaper there than here. And the vacancy rate's still 8%. And they're a much bigger city, more housing units in total, so 8% is, they've historically had way more units than people. And those are evaporating, right? So that their success, while important in terms of the way they've collaborated, it's got to be understood too under much more favorable
Yeah, they have a lot more
circumstances.
supply.
Well, and the other thing is that they operate under a different building code and the
Oh,
cost of housing is significantly less
Totally
in
different
Texas than it is
regulatory.
in Washington. We got a plan, we don't have a strategy. So,
We actually has no zoning codes.
what's that?
We don't have any zoning codes.
Yeah.
So it's just, it is. a different-
Completely different regulatory.
I mean, the state isn't. Anyway.
But they also don't put any data, like, at least when I was down there last year, they had been surviving only on federal funds. They hadn't been putting any state or local funding in, so that is also gonna come, they're gonna be challenged just because when the ARPA money, runs out and such, they're gonna be challenged as well. But to maintain all those people, right, and all those rents and that they've put into place, so anyway, we can learn a lot.
And I really think that this hopefully is providing a good framework to apply to the interlocal agreement. And really the premise of that interlocal agreement is that we as jurisdictions in the city of Spokane, city of the Valley, and the county are working together to support this and identify where we've got those funding restrictions on low barrier and high barrier, and making sure that we're coordinating to fill in those gaps, make sure that we're maintaining the healthy system through our funding allocations. So look forward to coming back to y'all with that interlocal agreement draft to review and further conversation.
Thank you. Thank you very much for being here.
for
Appreciate
having
all
us.
this, answering all the questions for us, so. Like, so my assumption, this will be on the consent agenda on March 26th.
No, that's
Yeah.
COC, only the COC adopts it.
Okay. Again, thank you. That's-
I think that applies to
This was more of just an FYI for us because that interlocal between the three is kind of connected to this.
Yeah, this board doesn't adopt their plan. It's only the COC board does.
Absolutely.
We brought a crowd today.
You did.
It's got a great-
You can just close the office.
Just temporarily shifted over here.
Yeah.
Get a real workout.
Well, welcome everyone. Sorry we're behind, so thank you for hanging with us and now let you go ahead and take over.
Excellent. Well, thank you for your time this morning. We wanted to provide an update of our water education program. We'll also talk a little bit about APA on the back end of this here, but we have our 2024 annual report. And Laura Goff, who's our education specialist, is going to walk you through what we did in 2024 through our education program.
Hello, yeah, my name is Laura Goff and I work for Spokane County Water Resources. And one of my favorite things is to share about our program because I believe in it. And hopefully by the end of this, you'll see why I believe in it and why also our community does. So a little bit about our program. We have the Water Resource Center, which is one site where we do education and outreach, primarily to K through 12 audiences, also to adults. We have the Doris Morris Learning Center, which I know a lot of you were out there at the groundbreaking. And then we do traveling programs. And each of those I'll talk a little bit more about. Who's advancing the slide? Okay. So this is our team. I'm the one with the binoculars there. Elizabeth Murphy, she works half-time with us and then half-time with solid waste, doing recycling and waste reduction education. And then Rayanne Nolander is my counterpart. And then we have Amy there, a perfect picture of her because she is the field and our wonderful support. All right, and you know, I wanted to put our partnerships right after our staff because we have 2.5 staff, but we reach a lot of people and we leverage the partnerships in the community. So we have strong partnerships with Central Valley School District, East Valley School District, Meade School District, West Valley Outdoor Learning Center. That's what that picture is of one of their naturalist volunteers doing the bird show. I'm not going to read all of them, but just to give you an idea, we are leveraging resources in the community to reach as many people as we do. So at the Spokane County Water Resource Center, we offer field trips through K through 12. We do focus on 3 main topic areas, the Spokane River and aquifer protection. And if you haven't been to the Water Resource Center in the 4 years, we have new exhibits and they're very interactive. So there's a couple pictures there. If you look, there's the girl in front of the aquifer and that lights up and it's life size and there's water sheeting down. And before we got that one, kids would come in and they'd say, is there water here? Where's the water? This is the Water Resource Center. And so right when they come in, they'll say, is that real water? And we're like, yes. And they eventually get to touch it. But a huge part of what we teach is, you know, what we call the buried treasure, all the water that we're gifted with in our aquifer and how there's no barrier between us and that aquifer, you know, and we have to be very careful to take care of that. And then we also teach with stormwater, and Bill's team is here today, and we provide a lot of their education component for their NPDES permit. So, and we also provide education for the Spokane Valley, their permit as well. And then we have the amazing wastewater facility, and you can see we're all smiling, they're excited. We make wastewater fun. I like to joke with people after they've been here at our tour is that they'll never think about flushing the same again, right? So one thing I like to teach is there's no such thing as a wave, right? I think even adults, we have that perception, but there's all these systems behind the scenes, there's technology, there's workers, and it requires all of us who are part of these systems to do our part. So we try to make it fun, bring a little levity to it, a lot of hands-on props to teach them how advanced our technology is and that we do really care about keeping our water clean that we're releasing to the Spokane River. So we also do traveling programs and we'll meet students for water sampling at the Spokane River. We've for the last few years, we've done Selkirk Middle School. They're about a mile away from the Spokane River. And so we'll meet them off site and do water testing with every one of their 7th graders. It's a really busy couple of days. And then we do also at Liberty Lake, we've met student groups out there to do testing. We'll have groups at the Doris Morris Learning Center doing water testing. And then we have special events and camps. So that middle picture that you see there is of the, we partner with the Northwest Natural Resource Institute and we do the water festival over 2 days with hundreds of kids coming through. Those bins look like just mucky water, but there's lots of life, and that life tells us how clean the water is. And then we also do classroom presentations. So as we all know, it's getting difficult for everybody to take field trips all the time with the bus funding. And so sometimes with the logistics and the funding, what we do is we'll visit the classrooms and bring really interactive hands-on science to try to bring some of that to them. Because we want every kid to get the experience of what we have to offer, not just, the more well-to-do schools. So I'm going to highlight our Wetland Explorer program. This is a pretty exciting program that we have because we're about to start our second year. And we got a $75,000 grant through the Recreation and Conservation Office. We always refer to it as NCLI, that stands for No Child Left Inside, state grant funding. And when the building was first built, we weren't exactly sure how much we would be utilizing it, especially since we had the Water Resource Center, we had our off-site programs, and we were keeping the same amount of staff. And so we wrote this grant with the idea that we would train all the teachers in Central Valley and East Valley, all the 5th grade teachers, so that they would learn the curriculum, get familiar with our building, get familiar with the equipment, and with the activities that we would be doing, so that we could make it more sustainable for the staffing. So eventually the teachers could leave one of the stations or maybe 2 of the stations, or if they were a superstar teacher, they could, after they've been through our training, just come and guide their students through using the materials that we have. So we got funded. We also provide the bus funding for the students to come, and we pay teacher stipends for all the extra work that teachers do learning that program. So go ahead and advance. All right, just a minute to zoom out, why outdoor learning matters. Research shows the average kid spends 7 minutes outside a day. So if you think about that, that's pretty low. But sometimes, especially in the winter, I'll think, gosh, how many minutes did I spend going from my car inside, right? And I'm a mom of 2, and it's just, the more we can get kids off of screens and outdoors and with their peers and learning, just the more positive. So that's what's really special about the wetlands is we immerse kids outside, where at the Water Resource Center, it's more indoors. And so the idea is that too, when kids are spending meaningful time outside, tromping around in the mud, finding frogs, seeing otters, things like that, wearing waders, that they have this core memory that's built, and hopefully they feel inclined to be a good steward of that space and of the environment. And then also too, we know that in public works and in our water, we need really good future leaders who have an interest in going into these fields. So some of the kids are like, you'd get paid for this. I want to do this when I grow up someday. So, maybe that will be a seed, right? Not every kid who comes through, but maybe one of them will walk away with the idea that they want to be an environmental scientist, or they want to be a project manager managing the restoration of a wetland. All right, and one of the core parts of our program is the partnerships that we have with the school districts. So Central Valley School District, in order for the teachers to attend our day-long training, they paid for substitutes so that their teachers could come during the workday, which made the attendance rate almost 100%. I think 55 out of 57 teachers came to a day-long PD. And that's huge. Substitute costs aren't nothing, but they believed in this model. They wanted their teachers to see this as an extension of their classroom in the Central Valley. Not just Central Valley, but East Valley School District did the same thing. And then Central Valley provides a full-time staff coordinator. That picture there is of PJ Jarvis. And they also have a support staff for the 5-week field trip program to aid our staff. So again, just one way we're leveraging that partnership. And the Wetland Explorers model is 3-part. One, we train the teachers. So they come out for a day, they actually wear the waders, they do the tests that the kids are going to do when they come out, they get familiar. We have pre-lessons that we teach them on so that by the time the kids get here for our field trip, they have knowledge, prior knowledge, so that we can really get into the field science. And then we do the field trip experience, and then we do pre and post lesson integration. So the idea isn't, it's not just a one-off field trip. It's this whole built-in curriculum, and it's a partnership with the teachers and the classroom. And again, those are just happy kids, right? Which we love to see. So the pre-lessons, we developed 4 pre-lessons, and they're standards aligned so that teachers are always getting asks on top of asks on top of asks when they are very busy. And so we wanted it to fit into their curriculum. And so all of these pre-lessons fit into the 5th grade standards, and they also tie into our water message. So we have a sketch like a scientist, thinking about how to do scientific observation and how to record, like in a science journal. Watershed Wonder, to learn about how water flows, connecting the 4 spheres, which is very strong connection to the 5th grade standard. And then What in the World is a Wetland, which is a paint tray model with dirt at the top and then sponges that represent the wetland. They pour water over, they get to get messy, they see the role that wetlands play, right? When we restore the wetlands, we slow that water down, pollutants get filtered, and we are protecting our waterways. So these, once we train the teachers on these at the workshop, they do all these lessons without any of our staff time in all of their classrooms. So that's 4 additional instructional hours before they get. Yeah, not here, but at the Dorsmore Slate. All right, and then the field experience. So when they get there, we do guided observations of the 4 spheres, which is basically water testing. You can see the kids are in waders there, loving it. I don't know if any of you have had little kids and you had to get a few of them into snow pants and all the gear. By the time you get them all into the gear, you're wiped out. But so for a little bit, we're like, oh, is it worth it to get these kids in the waders? Totally worth it, because when we got thank you cards and from the teachers unanimously, they loved that experience. It was like just so fun. I get to go in the wetland. It also is, they feel like a scientist for the day. Just really, really cool experience for kids. And then we also do water testing with macroinvertebrates. We call them macros for short, bugs, basically aquatic invertebrates that are indicator species. So kids analyze what species they're finding, and it tells us how relatively healthy the water is. And then we also do an ecosystems in action, looking at what birds we're finding and why they might be there. Connects to the macroinvertebrates because that's the whole food chain, why the birds are there. They come out for about 4 days at the Doris Morris Learning Center, or sorry, 4 hours with us. And then a lot of times, even at the Water Resource Center, when students come, they have an amazing time. They go back and then immediately they just go into their reading. The field trip is just this separate activity, right? So we're really trying to break that down with the pre-lessons. They come and have this meaningful thing. And then the teachers do a post-lesson documentation with them. So we have 3 post lessons that the teachers can do, and they can also create something on their own. So for example, if one class was lucky enough to see a river otter, then they can go back and study about river otters, and then they just take a picture of it and send it to us. And that's part of earning the teacher stipend, is that they're doing the pre and post lessons with their classes. There's also, you can see the bubble at the very end, the solutions. So some of the resource management issues that we are facing with our scientists, like, the water levels, with different property owners, how do you keep a wetland wet enough to keep the invasive species down by keeping your neighbors happy? We propose some of those to the students and sort of friendly scenarios, not exactly to the T accurate, but then they give us solutions. And it's kind of interesting to see them role playing and thinking, a lot of times we like to think in black and white, especially in our culture these days, right? There's right or wrong, or there's black or white. But really, a lot of the solutions are very nuanced and complicated. And the sooner we can get kids thinking about how natural resources are that complicated, the better. So anyway, they get to synthesize their experience, reflect on what they learned, and again, additional hours of learning that our staff is not teaching. That strong partnership with the school.
Where all public works good ideas are coming from. Explain a lot.
Yeah. Well, one was like,
I
just drain the pond and then send the fish somewhere else and then bring them back. So, yeah. All right, so year 1 outcomes. We served 1,565 students. And yes, I just raised my voice enthusiastically to say that because I was out there for 5 weeks every single day. And I survived 1,565 students. It was a joy. I got lots of steps. I never had issues meeting my watch step count. I did by 10 a.m. every day. And then this translated to 6,260 student hours outside. Which again, right, that wonderful thing of getting kids outside. 55 teachers trained over 5 days. Again, 57 teachers were eligible to participate, so that was huge accomplishment. I think when we first wrote the grant, we had set out to get half of all the teachers trained. And then when the school district said, we'll do it during a school day, that really tipped it over to be so successful. 27 community volunteers served a total of 450 volunteer hours. That picture at the bottom right is of Chewy, one of our wonderful volunteers, came out there almost every single day. That way we could have smaller student ratios. When you get kids out in the field doing equipment and looking at birds, it's helpful to have more adults alongside them. All right, I've been yakking about it, but these are some of the things kids said, right? And if you are not up on the young generations, this is sick is actually one of the best compliments you can get. So, you know, as a parent, right, when you think about your kid and what education means, having them say, I was so excited for this, I couldn't sleep last night, is probably one of the greatest gifts you can give your kid, right? Is an exciting experience like that. I love this. I want to get a pair of waders. Just, you know, and truly, kids are really excited about this. Yeah, these are their quotes.
Do go bird. It's good.
Yes, yeah. I forgot I was at school. All right, so that was our highlight of the Wetland Explorers, and I did want to highlight that because that was our first full year of operating in that building and doing that. And teachers loved it, and we're going on to year 2 soon. So back to our education program in 2024, we were able to conduct 147 distinct events. That's educational events, whether it be a community fair or day-long field trip. We reached 7,583 youth and 1,537 adults for a total of 9,163 contacts. And we achieved 14,307 contact hours, which is a record. The next closest year was 2022. We had 7,500 contact hours. So it was a really successful year for us. It was an increase of about 90%. Doing more efficient programming. So, if we have, for example, if we're visiting classroom and we have 4 5th grade classes that we're going to do, we'll bring 2 educators at once. And so we'll knock down 2 or 3 days of programming into one day. So that was one of the things, just more students, the volunteers really helped us get that as well. Switching. Great. And you know, why are we here? I'm a county employee. Public service, you don't get this very often, a 5-star review on Google. We, so far, I should knock on wood, do not have anything under a 5-star review. So after we have programs with teachers, we send them a survey and we say, if you are inclined, you may leave a review. So if you want to have a fun time, go ahead and Google it. This is just one quote. From a teacher, everyone loved it. All the children and parents were in awe at the organization, the hands-on lessons and fun. This is a group favorite, and we will do the trip annually. Such a great time, even the adults learned. If you're looking for a field trip with kind and patient staff, educational and hands-on learning opportunities, and an incredible facility, look no further. This is it, 10 out of 10. So those are just some pictures of practice with students out with us in different places. And this is another one, just the whole group, the whole program was amazing. The hands-on demonstrations were perfect for my age group. They all participated without exception. And I bolded this because, not because of my ego, but right, our county staff is what makes the county excellent. The best part by far was the facilitators. They were engaging in just the right amount of humor. Thank you. Again, we try to bring humor and fun to these public works topics so that students feel more engaged and want to be part of the solutions. We'd love for you to see for yourself. I know a lot of you have, there's a picture of a lot of you at the groundbreaking.
With 0 stars. Look at that.
Oh,
Way to
you know, I
build it. Oh
okay.
my.
No.
I was just about to say,
Man.
I want to fill them in.
Ron, get on and grade us. Or maybe you did already.
I was with you until then.
So I left those blank as a purpose to invite you guys so that you could then leave us a review. So we have students coming from all of your different areas. If you ever want to come to the Water Resource Center, especially after we have all the new exhibits, if you ever want to meet us at the river when we're working with one of your schools, or you want to come out to the Doris Morris Learning Center, we'll get you in waders and get you a nice photo out there. So, yeah. I think that there might be one more slide, but I'm ready for questions.
Can I ask the spread of the 55 teachers that have gone through the training? Are those primarily just 1 or 2 districts, the Central Valley and East Valley, or is that spread out the whole region?
No, all of Central Valley and East Valley 5th grade teachers is what the
Okay.
grant was for. Yeah. Now, in
Oh.
the future, whether we expand from that will be determined. This was a 2-year grant. And so this year we're doing a 2.0 training where we're teaching the teachers even more so the field trip components and equipment so that they can, after this grant, hopefully do more of it independently.
All right. And how much is the stipend?
It's $250 and that's paid for through the grant. Pacific Education Institute is a partner for us, so they administer that.
Okay. All right, and one more, I've heard that the transportation costs, the buses for the field trip has become a major hurdle, that obviously didn't seem to be when I was a kid, but what is sort of do you have any idea what the average cost of, providing a bus driver for a bus to bring, bring a group of kids
I don't know.
to the location?
I don't know for one bus, but I will say, in Spokane County, before this grant, we have had a partnership with Central Valley School District. Prior to this program, it was the Liberty Lake program. And we've committed for years to provide bus funding, and we provide $5,000. And I think last year it was like $100 over that. So like $5,100 for the whole season to get the kids out. Something like
And that's like every.
every 5th grader, yes.
Okay.
Yeah, so, and I don't know, beyond that, what the barriers are for them, but, cause it seems like nothing, right?
Well, you just think of how many buses are on the road before school, taking them to, and then returning them home. I mean, it's strange that has become such a roadblock to getting kids to be able to go on a field trip is the cost of a bus. But it's like with the number of school buses that are on the road every single day. I mean, I don't know. I don't know if are we talking $200 a ride, $300, $500 to bring them to and from? I mean, I don't know. I don't know what the cost breaks down to for one bus, but it's disappointing that I hear that from so many districts that's the barrier for kids being able to go to, I mean, not only this location, but any other place of interest that has a learning opportunity in the region.
Yeah, and I think it also differs by school district. So I can get the numbers for Central Valley and East Valley because we have communications about the exact number dollar per hour. It's easier for us to remember the whole bill because that's what we see as an invoice, but I can get those numbers and I think it differs for each school district because I remember there.
And distance from where the school is to where they're going. I'm sure plays a role as well.
Yeah, and whether or not the bus driver stays or leaves and comes back, that's a difference too.
I will say too, for a while, I think it's getting a little bit better, but post-pandemic, there was a bus driver shortage. And so they would have to rush back, like if they dropped the kids off at 9:30, they would have to rush back. Instead of having a dedicated bus that's outside of the morning and afternoon drop-offs, we have like an hour less field trip time than we did when it was the Liberty Lake program because they're using buses. We even have some schools that have to leave a half hour early so that the buses can get back, I think, to the high school in time. So that's a part of it. And then I think too, there's a lot of, standards that like, testing schedules in the springtime that they have to work around and probably other curriculum logistics that make it hard to plan across grade band field trip because you're coordinating with like 4 teachers.
I just have to say, super excited. I mean, this is part of why Mike McLaughlin's wife, Janelle McLaughlin, is a fifth grade teacher, science teacher at Central Valley when they're kind of working on the planning. And she really provided that teacher perspective as we were looking at as the architects were helping, design the Doris Morrison Learning Center. For this reason, because we knew that they're going out to Liberty Lake. Some schools go out to Turnbull, but there's no place for the kids to come in and learn inside space. And so that's why I think Doris Morrison's such a unique gem from so many perspectives. So just super excited to see it really actually coming to fruition on this side of it now. So thank you
But
for
it's
all your
too.
hard work.
Bud's excited too. He's got his binoculars.
I'm
There were
sure.
some kids today.
I'm sure he does. I haven't heard from him. Well, I'm assuming everything's going
Hear from him,
going
yeah.
good.
Congratulations, that's awesome.
Yeah.
I hope you can just keep continuing to perfect it and make it work and get those teachers trained up. I suppose there'll be turnover though and
Yeah.
new teachers to train and get it into a real rhythm. So it becomes part of the expectation with Central Valley and just part of what they see as part of their, the curriculum and education.
Yeah. And I will say too, because we presented at the Washington State Teachers, Science Teachers Conference in the fall. It was held out right off the site at the high school. And a lot of the West Side people who were counterparts in my thing were like, we haven't heard of school districts paying for their teachers during the day to attend a PD. Like, that's amazing that you got that. So it is really rare that the buy-in that Central Valley School District has provided for that.
Well, and then part of the funding for all this education comes through the Aquifer protection.
Yeah.
So as we look at what that is for the future, that's part of what funds these opportunities. So.
Thank you for that segue. Let's talk to you about the APA.
There you go.
Ron, do you mind pulling up that same presentation and going to the slides following it? Nope, previous one.
Keep going.
Yeah.
Back.
Back up a couple of slides, please. More. There we are. Thank you. So we wanted to bring back an update on the aquifer protection area and give you a high level of kind of reminder of what that goes towards and some current events with related to this pretty important component of our program. And a reminder, the APA is expiring at the end of this year. And should we want to consider a renewal, we would need to have a ballot measure here in 2025 to keep it a renewal as opposed to something new. So Amy's going to lead us through a few slides here.
Yeah, so thanks for that introduction. So just a quick reminder what the Aquifer Protection Area is. It's allowed to be established under state law RCW 3636. And something to note is that an APA area cannot include a city or town without their approval. So in 1985 is when the APA was established for the Spokane Valley Rathdrum Prairie Aquifer. We renewed in 2004, but that excluded the city of Spokane. And in 2025, we are considering renewal. And just to interpret that picture, the aquifer protection area as it currently stands is that dark blue. Our aquifer is in that hash mark area, and then the city of Spokane is in the light blue. Next slide, please. So this is our APA renewal timeline update. We are discussing putting it on the August 2025 ballot. So we need to get our information into the elections office by May 2nd. This includes the resolutions from our board and the participating municipalities. If we do a November 2025 ballot, that requires getting that information in by August. So
So we've had conversations about including the West Plains in the reauthorization of the aquifer, but nothing is shown here. So are you suggesting that we don't do anything for the West Plains?
I thought earlier discussions were to do something separate for the West Plains, if that is something that they wanted to move forward with, but keeping the SVRP aquifer separate with under its current so that it can be a renewal with the current area. So that was my understanding.
Okay. There'll be some resistance to that.
Okay.
Can I just clarify? So what you're saying is if we were to expand into other areas not with the Spokane Rathdrum Prairie aquifer, it'd be considered a new area and not a renewal?
Correct.
Just trying to, okay.
It would be new and it would have to be, the board would have to provide direction about how to, incorporate that. What programming would look like. We need kind of a, full direction provided on what we would be doing in that area. So the current focus has been on the renewal of the current area and including the city because of their past inclusion and them being right over the SVRP.
So I'll just want to clarify. So if we include the city, it's still considered a renewal? Not.
They will have to determine the language that they use on their on their component of it, kind of like a rejoining for them. So they're gonna have to have their legal advise on what that phrasing is exactly.
It'd just be one ballot measure
Yeah.
it's not separate ballot measures for each community.
So I'm not clear on how the verbiage has to say it for the city of Spokane.
There's no way you'd have different language if you're in the city of Spokane versus the valley versus unincorporated county. It's gonna be the same language for everybody. They're not gonna print 3 different ballots with for the same measure, 3 different language, are they?
I have no idea how that works. If you say maybe in a single measure that it's renewal for residents, it's something different for city of Spokane in a single line on the same ballot. We'll have to work with the elections office. I don't know how that gets phrased.
I don't think there's any way.
Well, it's through legal. It's not through the elections office.
Okay.
Elections office just puts whatever legal tells them is okay, does the ballot title.
But right, there'd be one ballot.
It'd just be one ballot title for the entire area.
So I don't know if it's approved or not, and then it's renewal for certain, I don't know if you could do it in the actual title of the item or how that works, just describing that it's a renewal for some and a new / rejoining for others.
That's something that would probably be in the voter's guide, but it's not gonna,
Just a
very
simple
confident
approve
that
of
would
the
never
APA.
be on the ballot, explaining that.
I think we do, I mean, because there's been talk of whether we add the West Plains or not. So part of the talk is how much is that really gonna produce and what would it really go for? So I mean, I think that's something you have to think through if we include that and then. I mean, but first and foremost, we've got to get the valley and the city of Spokane to come along, otherwise it's not gonna pass.
And Kyle, with your map here, I know when you came in last year, you had discussed, you'd had a number of folks that were up on the northern end of the APA that were, you said, so some of them did have a strong argument on why they shouldn't be in the APA. Some of them, their argument wasn't so strong, but you had said there were certain areas on the northern end you were thinking of maybe pulling in and taking folks out of the APA on the north end.
Yes, so since the first 2 issuance of the precinct boundaries have changed a little bit.
Yeah.
So that's something Ben and team are reviewing right now,
Okay.
is how those revised precincts and which ones get pulled in.
Okay.
But so far of the 4 municipalities that have been in the APA, we're actually having really good discussions with all. Liberty Lake has already joined on. Millwood has expressed interest. City of Spokane has expressed interest. In fact, we have staff presenting to them on Thursday, and then I'll be presenting on Monday. And the Valley has actually, despite kind of not bringing it forward last year, has renewed a lot of conversations and is expressing a lot of interest as well. And everybody has kind of nodded on the timing. Thus far, we were kind of waiting to hear from the municipalities of their preference on that, because we really need them to get passed, and everybody seems to be nodding at August.
But you haven't actually presented to some of the municipalities yet.
We have provided staff with information for the valley and have offered to come present to them. We're doing the city of Spokane, like I said, in the next week. And they've already kind of been teased with some of the information through staff level at the city. The mayor's supportive, the council president is supportive. So we're just gonna march through their committee organization, which starts with that climate resilience, the sustainability board, and then it goes to their public infrastructure and environmental sustainability committee before it would be in front of the city council for vote.
So I would suggest with the Valley to do the presentation on what's happening with our education program, because that is, they are currently part of the aquifer protection areas. The city of Spokane is not at this point. And so that is part of what the funds go towards, as well as, you know, I think having a list of every, you know, bulleting out what the funds go towards, because it's the monitoring and kind of what those things would go away. I think having the presentation on the success of our education program at Doris Morrisland, and it's, you know, the city of Spokane Valley incorporates a lot of Central Valley as well as East Valley. And then I'd also want to make sure, is Liberty Lake part of it or not?
Their schools are.
Their schools are, but as the, on the aquifer protection area. So we'd want to kind of do the same thing with Liberty Lake to show Liberty Lake why it's an important piece to them to continue to be part of the APA.
And we've offered to present to them. They already passed a resolution to join.
When was that though?
Last year.
Last year, right?
Yeah, when we originally were talking about it last year, they said, yep, we're in, here's a resolution.
But I think seeing what it does helps then to further get them to talk to the citizens as people are asking, should we not? And it gets their city council members, you know, up to speed as to what it's really happening and doing in their area. So I mean, I think, and let me know when you're wanting to present. I mean, I'm happy if I'm available to try to be there to attend. Because I think it just shows again what the county is doing and leading in this area and how we're helping, you know, future generations be able to preserve the aquifer, because that's really what all this training does. So, and I think it's going to get it more on the forefront as to why it's necessary to you know, renew this, as well as you know, just get the buzz going.
It's an excellent presentation. So I think, I don't know if I don't know if everyone knows how many thousands of students in the valley have been educated. So getting that in front of the council members out there would be a great idea.
And, you know, there's a lot of adults too on our field trips, so a lot of the parents and stuff. And I forgot to mention West Valley goes there with Jamie Otsby March. That's why we didn't exclude them. She just covers them coming to the.
Through the outdoor.
Yeah.
So I think this would be a good thing, because it's just kind of helping get the word out as to why we need to do this. And then I think, yeah, I think trying to figure out, you know, how does that work with the West Plains if we try to have the West Plains do it. So.
Speaking of the West Plains, I do notice, again, your map, I mean, would this be the entire city? Because I notice one portion of the city, a large chunk that's on the West Plains, and you can see it labeled with the Spokane International Airport in the middle. Was that the concept of having that included in the APA, it being the entire city or just a portion of the city? Because that does extend it a good chunk onto the West Plains.
My understanding is in the 1985, it was the entire municipal boundary.
Okay, but the municipal boundary has changed since 1985. Do you see any issue with including the airport?
I don't see any issue. I think the city, under our current funding mechanisms, the city gets a chunk of money to use within their municipal boundary.
Okay.
And to use for the allowable activities.
Okay.
And so we think that that would go to them and they would be able to use it wherever they would choose. And the aquifer protection area isn't specific to just the Spokane Valley Rutherford Aquifer. In writing, it's just that that's where it's was developed to protect, and the area is the area draining to that, and so that's been the focus of the activities.
Okay.
But there's still flexibility for using it within their municipal boundaries.
Okay.
Next slide. If we're- So the allowable expenditures includes planning, stormwater, sanitary sewer, drinking water, monitoring, enforcement, and education. The county has traditionally used our share for planning, sanitary sewer, monitoring, and education, just as a reminder. Next slide. And this is how we currently collect the fees and distribute the funding. The county assesses and collects a fee per parcel in the APA. And then the county's program costs from the previous year are deducted from the total revenue that is generated. And then the remainder is dispersed at a proportional rate to Spokane Valley, Liberty Lake, and the county. The city of Spokane, just an estimate based on parcels and average cost per parcel is expected to generate about 1.8 million. So that's for the current year costs there. You can see, and each city gets a proportion to it. The county's portion we have not been using. It's been going into a savings since the program costs come up sort of off the top. Next slide. So that pie chart there shows how we use the APA funds last year or 2023. The breakout is about most of the cost is for our staffing. That's that orange there. And then supplies for our monitoring programs about 3%, I think it says. And then the education materials is about 4% of the cost. And then other operational costs are about 15%. And then the administrative staff that does the billing, that's about, I think that's 15% or 16%. Can't see from here. So that's a distribution of those funds. In 2023, the costs did increase for our program. We had less funding from grants and less time on other work. We also had the opening and outfitting of the Doris Morrison Learning Center and the general increase in costs of goods and service for purchasing things. So that's partly why there were some increased costs in 2023 for our program, but 2024, we're coming more in line with historic costs, back to that 400K. We're waiting on the final audit to make sure that what I have in my spreadsheets match with what the budgeting office has. And then we do have future plans to reassess how we're spending our money to make sure that the costs are being spent appropriately. We're reassessing our monitoring program. There are some things that we are currently monitoring that we haven't had detections on for 20 years. So we think we can reduce costs by cutting out those parameters. We're looking for grants and other funding mechanisms, and we're building our volunteer program, and we're using SkillBridge interns to help supplement our staffing. Next slide. So just in summary, we feel the APA protects our sole source aquifer and it benefits our residents by providing that revenue stream for water related activities, continuing our programs, including our education program, our monitoring program that provides valuable data to our water purveyors and allows us to look at long-term trends. And we also, through our education program, Laura sort of alluded to this, but we meet our NPDES requirements for our stormwater, wastewater, and solid waste permits. So we definitely have a strong interest in putting this back to the residents to decide whether this is worthwhile to continue.
Just wondering from the board's perspective, if there's a goal in terms of August versus November. Or the team. I know there's the city has the parks and schools measure on this November.
I could just relay what I've
Oh, sure.
had in discussion with Marlene.
Yeah.
They are very much wanting August. So it's not on the same ballot as the parks and schools. Also, just from a county or from a staff perspective, August is a good time to ask people to think about water if they're wrong. Right? Just high level, but it's the board's decision.
Yeah, and we will have the treasurer will already be on the ballot, so Spokane County is going to have to be paid for part of the ballot. Yeah.
August would seem to make a lot of sense. Assuming we
All
can
these
get the
pieces could be,
answers from the jurisdictions.
The only thing is, yeah, I mean, do we? So it's May, is that we have to put that on. Are we going to hear back from the other two, or the Valley and the city of Spokane? I mean, we've got less than 2 months to actually hear back from them on, yes, we support this. I mean, I know you're presenting to them next week. You've spoken with staff in the Valley. But it's not staff that makes the decision on whether those jurisdictions are supportive of this. I mean, are you confident we'll have, I mean, we've been talking over a year with the Valley on this. Are you confident in the next 2 months, we get a thumbs up or an affirmative vote from the actual electeds that they are in support of this and want this to go to the ballot?
I'm feeling pretty confident about the city, assuming they vote in favor. Marlene's already got the timeline out, which is why we're doing these two committees right now, such that there's about a 3-week process for them to pass a resolution. They think we'll have it in hand mid-April. They know their deadline and they have scheduled it out so that the vote and the resolution will be in our hands by mid-April. Assuming a favorable vote, we'll have it. City of Spokane Valley understands the timeline as well. Whether or not they will pull through, I couldn't tell you.
So when you said you were planning on something else for the West Plains, what is that something else?
No, if the commissioners want to establish an aquifer protection area, there is no limit to the number of these that we can have. And so should there be one on the West Plains, should the municipalities on the West Plains want to be involved in it, we can absolutely establish one, establish a program, establish a fee, whatever that would look like that the commissioners wish to.
I do know the city of Bearway Heights has talked about establishing it. And I know it's been a topic of conversation for Medical Lake and Cheney. I don't know whether they would be willing to join or not, but I'm pretty sure Bearway Heights would be. So maybe we can get together and talk about how do we extend out to them and find out whether they're in or out.
Well, and there, it certainly begs the question of, are these separate APAs or a single one? I can relay that the city of Spokane Valley has established concerns of this APA going out into the West Plains.
Yeah.
The Valley is concerned the resources that is coming from their citizenry will be drawn out to the West Plains.
So I fully understand and appreciate that situation, and it's been a topic of conversation for folks in the West Plains as well. So.
can I follow up on that a little bit, Commissioner? So if the city chooses to go out and we do get this on a ballot and figure out these other cities and other jurisdictions, how does that work? I guess to the same point, how are your conversations going with the different jurisdictions about dollars that would go towards activities in those jurisdictions? I mean, school districts are across multiple jurisdictions and you're serving the Valley School Districts right now. So I'm just kind of wondering, what does that look like, or what would be different?
So, and I will note, CV and East Valley and West Valley have historical connections to our education program, so they have the strongest presence. But we do serve SPS, Meade, anybody who calls, we do everything we can not to say no. We're approaching the limits of what our staff can handle. With a renewed APA, we can look at that and demand of hey, if you guys want us to expand, we're happy to do so. So the way that the language in the resolutions, so we have an APA, which is, sorry, I meant to say interlocals. So there's two components to this with every municipality. There is, we want to be included in the APA, which gives the county the authority to include their residents in that assessment.
Right.
So that's the first part they include. The secondary component to that is an interlocal agreement, which is the fund sharing. Going way back, a lot of these funds were used for sewering and actually to help pay for the interest on our wastewater treatment plant. Really only in the last 10 years or so have we been doing the distributions out, because historically they were used for funds and everybody was kind of nodding in the same way. We're having discussions, particularly with the larger municipalities, of, does this make sense for you? Which is, in essence, the county pays for administration, education, and monitoring, and then we do proportional distribution of all remaining funds, and they can use it for anything that meets the statutory requirements of that fund usage. There could be continued negotiations. The city might, decide they want growth in our education program. We already partner with the city for some educational components, particularly on the solid waste end. So they might want to see some of that. Certainly we have to administer the program, but whereas there's a difference between the city of Spokane and the city of Spokane Valley, where the city of Spokane Valley actually relies on us to meet their permit requirements.
Okay.
So there's a slight nuance there that we would have to just establish out via interlocal agreement. That is aside from the resolution to opt in essence. So I anticipate additional negotiations to move forward with both cities. With if there's any nuance in how we tweak that. Frankly, I think it's all reasonable. The city frankly hasn't had any concerns. City of Spokane Valley really hasn't either. I think they might want to see some additional clarity in those interlocal agreements, because right now they're very broad. The county truly has all say in where those funds go. We've informed them, but it's truly our decision. So I could see us just codifying the current manner in which we do it, or potentially a tweak, which we would bring before the board for consideration.
Because some of those concerns could be addressed by just tweaking the language, yeah.
Yeah, absolutely. I recognize bringing in the West Plains is a challenge, because you have the city of Airway Heights is getting water from either their own municipal water system if they can get another source, or the city of Spokane, and it's a different aquifer altogether. Same thing with Medical Lake and stuff. And so I appreciate that there were challenges. I've been reflecting on the fact that there is a significant part of the population out there that is looking to try and create the APA. And I see value. Whether it's the same value for the valley or not, don't know that. Haven't addressed that, but this is the opportunity to take advantage of that.
I think, again, figuring out how much that would really, identifying how much money that would really bring in per
Right.
resident, and what could be done with that, because the monitoring is all done on the Spokane aquifer, not that aquifer. So what would it really look like? And would it provide enough funding to really do what they want?
No, I realize there's challenges.
Yeah, but I think we need to get, so I guess what we're asking as commissioners, we need to get some of that information to be able to make a decision.
I'll have that to you shortly. We've already collected the population data.
Yeah, so it's a population data, and what would we really be doing with those funds? Because I think part of what I'm hearing from the citizens that come and speak to us from the West Plains is that this is gonna be some kind of, fund for them to do different things with, and I don't think it's gonna be enough money to really do that. So I think that's why we just gotta be realistic as to what it could do.
Off the cuff, just if my memory serves, the last time I looked at this with Rob and Ben, best case scenario is you could get a monitoring program up and running if we had wells to work with. And that's about all that that entire West Plains would generate enough to run a monitoring program.
So yes, that's what we need to really work the numbers and figure that out. And kind of what wells would that be? So. Okay. Well, thank you. I mean, I think we're gonna need to look at, I mean, I'm happy with looking at August. Again, that I think my memory from being in the auditor's office before is your attorney will be putting forward the ballot title. That then gets approved. So then it's legal to go on the ballot. So the auditor's office does not have anything to do with it other than just putting what your attorney from Public Works, Water Resources has on the ballot.
We brought him.
Okay.
But it is.
Let's keep Jasper busy.
I was gonna say that Jasper, yeah.
It is true that I think the title would just be, renew, it'd be something like this aquifer protection area. And then it would probably be in the voters pamphlet that would be explained the nuances, right? Cause I don't, usually can't put too much in the actual title.
And it might be able to state that it's a renewal because it is a renewal for.
Yes.
But yeah, but those are the legal questions that need to be.
A lot of that would be like more voter education rather than.
We have a draft, it's pretty simple.
Right. So I think we just gotta stay in touch on this because the time is gonna go by very quickly for us to make that decision. And we wanna make sure that, I don't know if the cities are gonna want us to make sure you say it's gonna be on the ballot. For them to, put it on, or if we're gonna wanna say, we wanna make sure they're on board and put it on the ballot before we agree. So just things to think about as we only have a couple months, as Josh said.
As I recall from the earlier conversations on this, if one or both of the large jurisdictions are not in, we may have challenges to be successful. So I think we're gonna want them, at least one of them, to show their indicated resolution that's saying they want to be.
Historically speaking, the city of Spokane's vote is very much in favor of it from the first time they were on board. The city of Spokane Valleys was in favor and helped carry some of the rest of the county. But it was close in 2004. It was down to a small handful of votes with just the valley and the unincorporated. Whereas the city of Spokane brings a lot of votes and typically a stronger method.
It's just a 20-year renewal.
And I will say, we have provided a lot of the educational materials to Valley. And as they have, and the city manager has been shopping it with the council members, they have been very complimentary about the education program. And frankly, the fee hasn't changed in 40 years, that we have lived within the means of this. And that we set that number back in 1985 at $15 and it hasn't gone up, and that we continue to administer this program with that same fee is resonating very well.
Yeah, and I've talked to them more recently, and I think they're starting to warm up to the idea. I think it was last year they had increased their stormwater fees. So that was their issue. But again, I don't think they've seen all the additional things that we're doing with those dollars. With the Doris Morrison Learning Center now being open, that I think that will help show, that it's affecting their citizens and in a positive way. And again, it's a renewal, it's not an additional tax for them.
Yeah, so the reason why the city was supportive of the program initially was because it was also integrated with the STEP project. And the reason why we got out of it in 2004, and I led that effort at the city council, was because we had pretty much eliminated a lot of sewer septic tanks inside the city's jurisdiction. And so since it already addressed the problem that was originally identified when the program was put into place, that's why we got out of it. So if we're gonna get the city back in, which I support, but it's gotta be something different than STEP. Because STEP doesn't exist anymore. So what is that additional? And, you know, what you said with regard to, you know, protecting their sole source drinking water. This has got to be, I would think, high enough priority to where it would bring them back in, but I don't know, I'm not on that side of the river.
So in early conversations with Marlene, they've identified several avenues that they would be interested in utilizing their APA funding.
Okay.
Stormwater is a huge problem for them.
Yeah.
They have a myriad of issues to address on the stormwater side, as do all of us, right? Everybody's got stormwater treatment and disposal issues to address. All of the jurisdictions have seen the latest monitoring data, which is starting to show some concerning trends with nitrates in our aquifer, particularly north of the valley and at the state line. So some collaboration working with Amy does represent us on what's the Idaho Water?
Idaho, Washington Aquifer Collaborative and the Spokane Aquifer.
A lot of conversations there. The city certainly would like to be able to, since they're a drinking water purveyor, do their PFAS testing with this and watching for that. So they've already kind of begun identifying how they would like to use the resources. Then, you know, the communication education component is subject to us deciding to put it on the ballot. Everybody's already starting to think about that.
Okay.
Just a clarification, so the jurisdiction has to allow us to subject their citizens to the fee, right? So that
Subject is such a
I
challenging
know,
word.
include.
Yes, there we
But
go.
that's a prerequisite.
Welcome them
right?
into the family.
Yes, there we go. Okay, so I'm hoping, based on this conversation, that the jurisdictions can understand, we're really hoping for looking at August, and maybe that will increase the chance of getting some time decisions.
We've been relaying that, and I think they understand they need to move.
Thank you. All right, we're already at the end of your presentation.
I'm sorry, you're not up, Mike.
Oh, wait, no,
We have one more still.
okay, sorry.
And if we're gonna talk about water, let's just talk about all the water. Okay. One more presentation for you all this morning. Thank you for your time.
Okay.
Many of you have seen, or I should say, you all have seen this information. So this is just bringing the conversation to the entirety of the board and answer any follow-up questions you may have. This is regard to the update of our stormwater comprehensive plan, discussions about our service boundary and rates associated with that. As a quick two fun little numbers for you, the rate runoff event that we had just 2 weeks ago here. We received more calls and RFIs from the public by noon on Monday than we did for snow in the entirety of winter. We are still addressing the roads that suffered damage. We will be addressing those well into the summer. Early estimates just to get those back into drivable condition is $1 million to $1.5 million. It's the entirety that we were potentially saving from winter options from a light winter is all out the door in one melt-off event.
Well, don't sugarcoat it.
You know, and we have all talked about this a little bit, but the big important thing is getting this expanded to the entire county. And we'll talk more during the slide presentation, but what that'll allow us to do is actually put in drainage facilities in terms of ditches and cleaning out culverts
So the road gets drained, and this has a couple of things. One, it keeps them from washing out, events like we just had. But another thing that we're seeing right now is we had that deep freeze and we had frost go pretty far into the ground. And when it comes out quickly, it buckles the road. And if you have well-drained roads, you don't get the moisture building up in the subgrade material of the road. And you don't get those frost heaves nearly to the same level. So we haven't talked about that yet, but the damage from that also is likely well beyond $1 million this year and is going to cut into our preservation. That's pretty new. That was new since we've talked to all of you, is we're seeing that frost coming out and damaging large sections of road, some of them 1,000 feet or more, that we're not in plan to do anything. These are our chip sealed and asphalt roads. So that's another big one for us, is this drainage issue goes a lot further than just the runoff events. It's also just keeping the roads in good shape and not potholing and not breaking apart during the spring thaw. Next slide. Ron. So part of this is the update of our stormwater comprehensive plan to align with the county's 2026 comp plan update. And a big part of this was, updating and prioritizing our capital improvement plan. What do the rates need to be to meet the goals and the requirements of our permit, but also of starting to establish a minimum level of service for areas of the county and expanding that service area to the entire county. Next slide, Rob. So just as a background here, this is how we manage stormwater in the right of way and mitigate flooding, and has a huge water quality component. It's governed under our MPDES permit. And was established in '93. Fees have only been updated a couple of times nominally in '07 and again in 2024. And then that service area predates the GMA. It was in '92. It's got some UGA area, some non-UGA area, and it has not been updated in more than 30 years. Next slide. So the image on the left is the original stormwater boundary. You just see that purple area. It's a lot of the urbanized components of the county, a little UGA, a little non-UGA. And the proposal is to go county-wide and incorporate the rest of the county that's unincorporated. If you look at some of the numbers on the bottom there, you can see that so only about a third of our lane miles are currently incorporated, but only about a small percentage of our culverts. We have 3,000 culverts in the boundary now of 27,000 total culverts in the county. So there's a huge swath of unfunded maintenance needs throughout the entirety of the county. And really, it's important to note that this work, and I'll reiterate this a couple of times, it's very visual. This is not dollars that are just going to go to one, area of the county or one little component. This is going to be touching every road in the county in some way or another. And that presence will be seen and felt by our constituents. Next slide. So the rate study was done as a way to better understand what would we need to do to address the drainage outside of the current service area, and also understand with rising construction costs or MPDES requirements that went into effect in August of last year and also increase year after year as part of our five-year permit. And then what can we establish as a baseline level of service? You see some lovely pictures of rotted out culverts that we have no funding to address. Yeah, we've talked about this in the past, the challenge with the large diameter culverts and the short span bridges that aren't eligible for federal funds.
that we do not have any funding source for those, and they're a big programmatic hit when we aren't anticipating them. We've been working the last couple of years and we're continuing on with our culvert inventory to just get our arms around what the issue is and what we have out there in the world, and then come up with a program to address it in an organized fashion where we can actually plan the funds and plan the crews to do the work. You know, we've talked, if our crews do the work, we can oftentimes do these large culverts and short span bridges for 200,000 or 300,000. And if we have to contract them out, we're closer to $1 million typically. So, you know, it's good money spent. It's much more effective when we can program it and have it laid out, and quite likely would develop an additional crew and our bridge crew to do this work in a more robust fashion. If this were to pass, it would allow us to actually have something. Instead of reacting to situations and spending $1 million in an emergent type situation, it allows us to have a program and address the important ones first. You know, we'll be looking at how important is the road in the system, and that'll all play into the programming of these culverts and short span bridges. So that's really an important piece for us too, that has been unfunded so far.
That's like. So this is really visual work. Obviously, when we have closed roads, eroded roadways, we have weight restricted bridges and or have to close a crossing. The citizens are going to truly see it. Keeping water where it needs to go is really important. You know, when we wash out a road, we've had a lot of roads closed, or maybe we've gotten a 10-foot wide single car width open. That is going to take a long time to get back. So less closures and detours. But really it's a 2-for-1, right? If we can keep the water off the road, it protects the road. But also a lot of this emergent work, when we have events like this, we have no choice but to use the road fund. So this would allow us to have some funding allocated to this, which when you take that burden off the road fund, just allows more dollars to go into preservation and maintenance. So it's really a 2-for-1. We protect the roadways, but then we have the ability to invest further in them and improve that those roads for our constituents.
Yeah, that one I think really is important for us. I mean, that's offsetting those dollars and getting more money back in preservation. Like we've talked, you know, we were hoping to free up some from the winter. That didn't work out with this big storm event. But right now we're funding it at about $4 million a year, and reasonably our crews can self-perform $9 or $10 million a year right now. So we're far below the mark we'd like to be at. This is one avenue for us to offset those maintenance dollars that are currently budgeted and come back into preservation. So it really is a twofold win for the county.
Next slide. There's just a fun one. I think that we give you the PDF version, so you don't get to go through the full slideshow of the issues, but you can see some of these areas where we showed you some washouts, but this is also where we have complete edge loss on the roadway. And this happens on some of our rural areas, but also, I mean, Dave Mount Spokane Road was at complete risk of losing the side of the road there, which is a huge safety concern, but then it's a big cost to reestablish that. We had crews 24/7 monitoring Dave Mount Spokane with this event, and then we lost some serious edges on our roadways throughout the county. So as we did the rate study, we looked at what are we doing today with our existing level of service. It's worth noting that our current level of service does not meet our new permit requirements. We have to do to be compliant. And then we looked at a minimum. So what would we do to meet our requirements, maintain our system functionality, and then really set up kind of a minimum streamlined program to go countywide. We also looked at a little bit more of a proactive level of service that would be even more aggressive. But at the end of the day, we need to walk before we run if we're going to expand to the kind of area we're talking about here. So if you go to the next slide, you'll see the staff recommendation, which is to go with a minimum level of service, but go countywide. So hit our permit requirements, hit our street sweeping, a formalized ditching program. So the target is a 3% annual completion rate for the county road network. So it would take a long time, but at least we can program that out. We can hit some of our most concerning roads first and move forward. And cleaning out our culverts and actually having a program where we're hitting those thousands and thousands of culverts. Once, if we can keep the water moving, it's a lot of times those block culverts where they overtop the road and we get big washouts at a culvert location where the water is supposed to be moving. And then we have funds available for short span bridges and culvert replacements. It's not a huge number. It's about a 1% completion rate for replacements, but we can be programmatic, we can be strategic and actually expand that and move forward. So for this minimum level of service countywide, you can see the staff recommendation on the top line compared to the consultant recommendation. They were recommending we ramp up to that sustainable rate immediately, basically in 2 years. We think it would be our recommendation to gradually increment over 4 years to that proposed level of service. Let us ramp up the program, get it better vetted and kind of bring it on a little more slowly and also ease that burden to the citizens as they work up. So for many, this will be a new fee for about 2/3 of the county that is paying the stormwater fee. Some will see an increase, some will see a decrease for the first 2 years as we work our way up to about that $7, which at that level, that's really where we hit that recommended level of service. Anything beyond that might be a CPI consideration, but we wouldn't be recommending going beyond that. However, we would ask the board to consider adopting that fee table such that this is programmed in and can be planned and programmed over the next 4 years. Here is where we compare to the rest of Eastern Washington. We are currently on the left end of the bar. We are the lowest in Eastern Washington that has a stormwater fee. If we adopt the recommended rates, we will be still at the very low end in the bottom 4 of Eastern Washington and well below our, certainly, 20% below our municipal counterparts. It's also worth noting that many of these jurisdictions have already published rate increases over the next several years. So these is not a static chart, but we intend on staying on the low end of it as we continue to progress. If you want to do, we've done a few comparisons to Western Washington. They tend to be up at that $9, $12, $15 a month range. So we're even with this expansion staying at the very low end compared to our counterparts. Next slide, please.
Can I just ask clarification?
Sure.
Can you go back one more? So that's the average fee right now? $4.
That is the recommended.
Oh,
The
okay.
green is our recommendation.
And the red is where we're at now.
Correct.
And is that, it varies by area currently.
Currently in the service area, the base fee is that like $2.20. And then we have special areas, particularly
Oh, I see.
5 Mile, Glen Rose and West Plains that are they're at about $5.50. So they'd be kind of up where the cities are right now, a little above that in the current term.
Thank you.
So the challenge with regard to drainage and the impact that it has on the road systems is something that is being experienced by counties statewide. And a couple of years ago, the state legislature authorized the CRAB board to establish a emergency loan fund to be available for counties to try and address some of these issues. The challenge with the loan fund is it's got to be paid back. And so it ends up being paid back in future allocations from CRAB. So you aren't really addressing the long-term stability of your road system, all you're doing is you're addressing the urgency of the damage that's been created and stuff. So what is being presented is a long-term strategy that doesn't impact our CRAB funds, that provides some resources available to maintain our roads.
Thank you for the context, Commissioner. And we did reach out and we asked that they give us a forgivable loan, but we got shut down, unfortunately. Most of southeastern Washington got really hammered recently and are all experiencing dramatic costs, and pretty much everybody is sticking with out of pocket for that exact reason. So this slide we can.
Just a second,
Oh.
before we go to this slide, go back one. I just want to make sure. So the green is, that's at $4.
Yes, that's our recommended level of service
That's
for
if this was adopted.
2026. So
Just for the first year.
yes,
And then getting to that $7 by the end of the few years.
in 4 years is where we would aspire to get to 7, and that whole chart is going to continue to climb with everybody over those years. Most of them already have published rate increases. The city of Spokane, is the study going this year?
I don't think they've started it yet, but they're planning on starting it in the near future, and they expect them to rise pretty dramatically.
Thank you.
So the next slide just has the assumptions, if you're at all interested. There are some code changes that will be required because sets reserves. We would, the recommendation out of the rate study is that we set a target $2 million capital reserve for an unexpected capital need, which you can certainly see happening. And then 120 days of cash on hand, which I think is reasonable, frankly, maybe even a little low, because of the way the stormwater fee is collected on property taxes. We have to ride out 6 months of operational cash flow. But we can manage with that. You know, it's a minimum. We can maybe err a little higher on that in the summertime, and then kind of backfill over the winter, because that's when most of our funds will be expended. But that's about a $5 million roughly, with a slight growth on that reserve. So one of the nice things is that we do have a reserve built up, and that is particularly because of our GMA issues. Those were planned capital projects that we haven't been able to get funding from our partners with. So we are in a good spot. We're not starting to fund our reserve today. We'll actually be using fund balance to kind of offset that ramp up of rates over 4 years, and then bring us down to that $5 million a year reserve. In fact, if we expand the stormwater service area, even though we won't be collecting funds until 2026, we can use some of that reserve balance to offset some of the issues we have from this current event and not be so sideways with the road fund in 2025. So really, this is just the opportunity to start thinking about stormwater countywide instead of solely in our sort of urban service area. We're well on the low end of the curve for Eastern Washington, let alone statewide. But the biggest thing is this double win. I mean, we protect and extend the life of our road network, but we also expand or offset a lot of what the road fund is having to pay for right now because of no other option. So we'll have more dollars to put into the roadway. And you know, the other thing, I don't think we hammered on this, but there's a lot of private property damage that happens by not having our stormwater managed. And so, you know, this work that we're talking about is going to be very visible. You know, where we collect the fees is where the work is going to be done and continues to be done in the stormwater service area. So it really does touch every corner of the county. And we think the constituents will really feel it. Rob, is there any more or is that it? Oh, sorry. Next steps. If the commissioners are interested or have any modifications, we would propose a pair of draft resolutions for public hearing. One is the service area expansion, which would, I believe, which would go countywide with our stormwater service area. And then secondly, would be adopting these rates for the next 4 years. Certainly the commissioners can change that at any time they so wish, but this would set us up so we can really build that program and ramp up over the next 4 years. And we'll include a couple of those little code changes in that as well.
What would the estimated total amount be collected per year?
So in 2026, I believe the number's a little under 6 million.
Okay.
And then it ramps up to around 10
Okay.
in 4 years.
So you had a whole list of projects that you can work on. How are you as far as workforce? Would you, how many people would be assigned to this type of work?
So there's some really cool components to this because it's a mixture, right? So what's cool is our road maintenance staff, which we've been, we basically, because of just inflationary adjustments in our road revenue, we basically have to cut a head count out of road maintenance every year. Just to stay with our costs. So this will likely offset that burn because they're the ones to do the work, the ditching work, culvert repairs. We want to do a lot of that in-house. We might be adding some staff to the bridge crew. We have to add some office staff to meet our permit requirements. One of the permit requirements is we actually have to be inspecting private stormwater facilities, which, what is it, 2-3x of what we would have?
Yeah, there's about 5,000. We have about 8,000 that we're inspecting right now. And there's an additional 5,000.
So that's on the office end. RMSs, we want to do a lot of that work. We may also blend in some contracting for the culvert cleanouts. There's a couple of contractors in our area that can do it very efficiently and quickly. And so it's a little bit of a blend. So it'll be some head count. It'll be keeping our RMS count from dwindling further. Maybe even be able to add back 1 or 2 because we will be paying for the street sweeping, all the ditching and culvert replacements. So those things actually are coming right out of the road fund that we can put back into the road. So.
Okay, so how many new FTE counts are you thinking bringing on?
I'm having a hard time with that because I don't know exactly how much of that work we can sell. In the office, we're probably talking 3 or 4 to manage the permit requirements. In the field,
Yeah, I would say 3 or 4 in the office, call it 5 or 6 in the field, and that's just. And what that does, like he's saying, I mean, you're offsetting maintenance work, we're covering with RMSs, but we gotta keep them for winter ops. We gotta keep them for spring grading. Those times when we have the staffing challenges, our special crews are pulling so many people out of district that are maintenance districts during the summer when they're running, there's nobody left. Because we do have to keep cutting headcount just to stay within our budget, stay within our means and keep money preservation to the degree we can. But this will offset a lot of that. Having the maintenance folks being paid for partially by this would be a big help to keeping the staff levels in maintenance where we need them to be for the rest of the year. So again, it's back to that double win for us. We're using our staff that we can do a lot of other work with the rest of the year.
So seeing the next steps. So this is something that we can just do as the Board of County Commissioners. Because we're carrying out that. So now we're beyond time on time. So anyway, so I think I would say we need a little bit of time to digest this and have you come back. I don't know, are you guys ready to put it? I mean, I'm not ready to put it forward to vote. I need to. I think digest a little bit.
Whatever the commissioners would like, we're ready to move forward. It's spring, it's runoff season, it's timely. And the fees don't get collected until next year, but it'd be, expanding the service area by commissioner action will allow us to mitigate some of the damage this year with some of our fund balance. And we can get working on our program.
I guess that was my question, because you were saying that this year we could see some impact on savings to the preservation fund or replenishing that, but yet we won't be collecting until next year. So you're saying use some of the fund balance knowing that these dollars can go back in to replenish that. Is that
Exactly.
okay?
Yes. So,
Okay.
yeah, that's another, just, whenever the commissioners are comfortable, certainly you guys tell us what to do. There is a planning component to our preservation program that we do have to make some decisions on.
I just want to make it, so. measure where things are at.
Can we, I mean, I'm fine if you wanna kick it a week. You listed off culverts, you listed off ditching, you listed all that. Can you get us a list of all the permitted uses for these dollars and maybe a list of common road things that wouldn't be permitted, just so we can kind of, you know, just sort of get a better idea on this is what it can go to, this is what it can't go to?
Certainly. So, and then we'll come back whenever you'd like us to. If you'd like us to come back in a week, or two, it doesn't matter. And then the first action is that setting of the public hearing, which would be 3 weeks following that before it would come to the commissioners for a vote.
And then also, I know when I got the presentation, as if you can get us a picture of it, I mean, there's some pictures of what I assume are a improperly ditched road. Could you get us some pictures of what a well-ditched road shoulder looks like? Just
What we're actually aiming for.
Yeah, let's just so you can kind of compare the two. I'd appreciate that as well.
And I think having the numbers as to how much this last event really has cost us would be helpful too, to show again the benefit that is going to be received by this, doing this versus continuing to do what we just did, because we know it seems like it doesn't happen every winter, but every other winter, it seems like we just have that huge snow melt that just, you know, with rain that just trashes the roads. So I think having some of those hard numbers to show why this is just justifiable.
And not only could we have, you know, funded this certainly in stormwater, but also it's that preventative work. We would just have been able to prevent a significant amount of the damage we've recently received.
Right, but I think it shows, because we haven't been able to do this, here's what it just cost us.
Exactly.
We have the cost to the road preservation fund, and those are funds then you can't put into other road grading and projects.
I'm sorry to tell you that week by week, that number keeps going up. That's what I understand.
Commissioner French.
Yeah, so the bigger conversation, I think this is going to prompt is funding for the roads after the RUC goes into place. Because gas tax money is not going to be available like it has been in the past. And we use some of that distribution for gas tax. And with the implementation of the RUC, that's going to change. We don't know how much of the RUC is going to come to counties or if the state's going to keep all of it. And there's been conversations about the state keeping all of it and then creating other opportunities for counties to fix their own problems. So this is going to prompt a lot of conversations with regard to what we do with regard to roads. So I'm fine with moving forward on whatever timetable is agreeable to the rest of the board. I mean, it's something we're going to have to deal with.
Yeah, to bring it back next week so we can get kind of more of those answers. And
Can I ask if you, when you come in next week, can you bring sort of, I mean, to the point what Commissioner French was just talking about and Commissioner Waldron showing, so show your overall road budget, show where the funds are going, showing sort of today where this piece, how we currently fund washouts, you know, when there's a culvert disaster, that show how much is being pulled from what you are currently doing from with the roads budget, and then showing sort of, you know, and then, I mean, just to give, I mean, because, I mean, what we heard today, you're having to pull funds. Okay, but what does that mean? How much? How many funds are being pulled for, you know, what's the dollar amount? What's that preventing you from accomplishing with that? I mean, it's, you know, we're kind of speaking in generalities when it comes to the overall budget. So, I mean, being able, you know, to allow us to, I mean, when we hear from constituents, hey, this is the amount of funds that can't go to grading your road, can't go to filling potholes because it's going to fixing something caused by flooding. So that would be really helpful.
No problem. Do you have a preference as to strategic planning versus briefing next week?
Probably briefing if we're looking at setting a public hearing. I think
Yeah, I would.
Monday or Tuesday.
Tuesday.
We'll be ready for it. Thank you so much for your time and consideration. I really appreciate it. Any other questions? We'll, happy to answer. If you think of anything, just shoot us a note. Thank you.
Thank you. Okay, so we are way behind on time. I know a lot of us can hard stop at noon. You had an executive session that you really wanted to have happen? And
We can, yeah, but I won't be here tomorrow morning and stuff, and so, yeah, so
I mean, is it 5 minutes or,
I can make it 5 minutes.
Mike, we're gonna have to figure out pushing you, so I apologize. Scott and I will figure out that or push you too. Because, yeah, Commissioner French and I will both be not, gone in the morning. I'll be able to call in it too. So-
Goodbye. Goodbye.
So, okay,
Sorry.
You guys were the weakest link.
yes. So,
I'll do the Reader's Digest version and just the board and Matt and Scott. That's it.
Are you here tomorrow?
Yes,
So we could possibly do this after or 2 o'clock.
no, no.
Not yours, not yours. I was talking to community service.
Yeah.
I had one quick thing, executive session just to put on your radar, searching for the date. GSI annual meeting is on a Tuesday morning,
yes. I was
March
gonna bring that up.
25th. I just wanted to float that
Yes.
out if we want
Which,
to.
which I think is a really good, the speakers they have coming are really great.
Well, something we've always attended. This is, I think, the most inconvenient time they've ever picked. Usually it's a 7:30 start time. And then there's been some years they've done like 4 PM or 5 PM. So, but instead, this year they're starting at Tuesday at 9 AM. So,
Because I think kind of the way these speakers are, they're busy as well, so.
okay.
So anyway, so yes, so 25th. I guess we would
25th,
delay,
Tuesday.
not have a Tuesday morning meeting. Figure that out.
Not at all.
that
What time to
Monday.
start?
It's 9 to 11.
I mean, that's the calendar hold, whether it lasts the whole 2 hours, who knows?
I'll be back. See that. So.
So,
So we could move it to Monday then, our briefing.
yes. So we just go and go through that. Okay, so we're gonna go to executive session for 5 minutes. Commissioner French, what's your purpose?
Pending potential litigation.
Okay. Everyone, there's no one online, so we will adjourn after the end of that 5 minutes, because we all have meetings we gotta get to. And then we will reconvene tomorrow morning, at 9 o'clock, or we'll, we adjourn for today and see you all back.
Do you want to do any continuation of this or tomorrow afternoon?
No, I'll be in touch.
I don't.
Always in touch.
Yeah, I don't know what your schedule is tomorrow. Family dinner.
I don't know either. My goal is to be here, but there's a lot of things in the air because of what's going to happen as part of the executive session.
I'm traveling. I'll pass. This week's already clean my car. Okay, clean your car, Chrissy. I'm coming in.
Okay. Gotta get into my 5 minutes.